Hi everyone, very good afternoon guys. I hope I'm audible and visible to all of you, and I would need a quick confirmation in the chat box if all is well. And welcome to this very quick one-liner session where the thumbnail only has my picture because this is not a session that I am taking. I believe this is a session that all of you are going to take because I have nothing to teach you. It's completely based on a test format, fill in the blank one-liner format where I don't have to answer, and I hope I don't have to answer anything and you all will have all the answers ready. So we've kept 100 is just a very random number because you knowing me know that I must have put in a lot of content in every slide. So it will cross 100, but especially for the FMG students with the exam coming up, this is going to be helpful. Before we begin, one more thing. Yes, the video will be available later on. Second, please don't ask for the PDF because you know I will give it to you. You will get the annotated PDF, so don't waste your time searching for it. You will get it after the class. Thirdly, this is a one-liner session, which means my focus is not at all on the images for today. I have done the image section in LRR very thoroughly, so I don't want to repeat things. I am focusing only on the theory part, which I feel very close to the FMG exam. You need a lot of revision. So we are going to do a recall of the theory aspect. Very few images we've got for today because I wanted it to be a text heavy session. So of course this is for NEET PG also. I mean the content is the same, so it's just FMG me addressing it because that's the closest exam that we have. So those students are going to be the most tensed, of course, but nonetheless it is for every exam aspirant because I am going to teach you everything that is common to the exams. Okay, so let us start. How many hours? No, I want it to be, Dr. Chandra, the shortest session possible, and that depends on how fast you guys answer. The faster you answer, I can finish off in 40 minutes also. I mean, that only depends on how fast you guys answer, but let's keep a timeline of 1 hour and we'll make sure that we don't exceed that. Okay. No, this is of course of path and micro. I'm not teaching all subjects, so I would not want to go into the one-liners of those. Before I begin, I believe especially for the FMG students, this is how life has been for you lately because this is a vicious cycle that all of you are stuck between. How many of you are going through multiple, all these three in the same day where you want to cry and then you want to study and give the best exam of your life, and then third is when you don't want to do anything and watch a Netflix movie. If you're going through this vicious cycle multiple times in one day, trust me, you are on the best track because someone who's not going through this means that person is not in that exam mode right now. If you are feeling all these emotions all in one day and multiple times and you're feeling something is going wrong within you, I think you're on the right track. I would be very happy because that is the story of every exam aspirant, and everyone who's gone through this has come out as a winner and will always get a good result because when you study a lot is when your body and your mind goes through all these emotions. So I always take it as a positive sign, right? On that note, I hope right now this is how we get going with this session, and let's start. Path micro mixed hoga. So you guys have to answer super quick. We are starting with what are the caspases, the first one liner. So apoptosis ke caspases, when I talk about initiation, they are going to be 8, 9 and 10, and for execution the caspases are 3, 6 and 7. Okay, someone said the voice. Sorry, before I begin, I hope the audio seems to be fine. As per my end, it's okay. And if it's troubling anyone, either reconnect or just try using some headphones, okay? Now, moving on, what is the caspase in necroptosis? It is none. In necroptosis, there is no caspase. There is a procaspase, which is 8, but no caspase, mature caspase. Talking about pyroptosis, the one which has fever also, that cell death uses 1, 4, 5, 11. So that is going to be all the different caspases that you had to know. I know there's a 10-second lag that YouTube has. So I'm assuming that all of you are writing it down. At any point of time, I feel someone has given a wrong answer. I won't call out your name, but I will correct you in that manner. Many of you have said only 1 and 11. Guys, the update I had told you in the new rapid revision videos, it is 1, 4, 5 and 11. Perfect. Moving on to the next, FMG and NEET previous question. What is the role of sirtuins? So sirtuins, you all know, drink wine, enjoy life, increase sirtuins in your body. So the benefits are going to be ABCD. Number 1, it helps in increasing our lifespan, that is anti-aging. Now it is said to be as a treatment for cancer, maybe it can be used, and it can be used in the treatment of diabetes. So these are all the benefits of sirtuins that we have. Perfect. Moving on. All these one-liners are basically, I've put all the PYQs together. Let me just tell you my thought process behind it. So Werner syndrome, you know, what is it? It's like a progeria where someone gets old very, very quickly. So it's an adult progeria syndrome. PYQ was, why does it happen? It is a defect in DNA helicase, and that's the PYQ that you have to know. Perfect. I can see one of the best answers coming up. Let's space up further. Going on to what are the events of inflammation? We all know there is a mnemonic for cellular events, that is MRAT-COP. Just giving you a 10-second recap. Margination, rolling, adhesion, transmigration, chemotaxis, opsonization, and phagocytosis. I'm sure MRAT-COP everyone knows. I am asking you what is rolling due to, the second step, and that is due to selectins. How many types of selectins did we have? English Premier League, E-selectin, P-selectin, L-selectin. Done. Moving on to the next step, that is adhesion. Adhesion is because of integrins. How many integrins do we have? We have beta 1 and beta 2 integrin. This also we know. Moving on to the next one, that is transmigration, which is also known as diapedesis. That is because of PCAM or CD31. Please note, CD34 is the marker of what? It's the marker of endothelial cell, blood vessel wala lining. And CD31 or PCAM is the marker for transmigration. Which is the best opsonin? Again, famous PYQ. Best opsonin is IgG. But if they ask you the best complement opsonin, that is going to be C3b. Please read this very carefully in the exam. What have they asked me? Best opsonin, IgG. Best complement opsonin is going to be C3b. Perfect. Moving on to the next one. Now you've done the MRAT-COP, do the defects. This question came in the last exam also, especially for FMG students. Which out of these is associated with Bombay blood group? So LAD2 is associated with Bombay blood group. Question ye nahi tha. They said, how do you write the report of a Bombay blood group? When someone is A positive, you write A blood group. B positive ke liye B, AB ke liye AB. O blood group, you write O. But when someone is Bombay blood group, you write OH. Capital O, small h. If this is written, that means they're talking about Bombay blood group. This was the question of the last FMG. Whereas LAD1 is associated with a problem in the umbilical cord stump shedding. That doesn't happen. Talking about Brutons, the next one, BBB chalega. So this is going to be seen more commonly in which gender? In boys. Which cell problem is it? It's a B cell problem, and it is going to be BTK gene defect. Coming to Shediac Higashi, what is that classical hair color that all of you have to know? It is going to be the silvery gray hair that these kids have, and for those who are recalling, I can see some answers. It is the List gene defect that happens. Coming to the next one, no one's forgetting chronic granulomatous disease. What is the screening test for CGD? Screening test, chota wala test, which I used to teach you as the Nibba Nibbi story. So the name of that test is going to be NBT. NBT is nitro blue tetrazolium test. That is the small screening test. But if you are asked, what is the final diagnostic test? D for D. Diagnostic test is DHR. Perfect. So many. Why have you come for this session? You know everything. Okay, moving on to the next one. Fill in the blanks for wound healing, because they will tell you from surgery also and in path also. Number one, when does granulation tissue begin? And next, when does collagen formation begin? So everything begins on the same day, that is day 3. Granulation tissue, day 3. Collagen formation, day 3. But granulation tissue becomes maximum at day 5 and collagen becomes maximum at day 21. So what did I say? It is, everything is going to start on day 3. Starting is day 3, but granulation tissue becomes maximum on day 5. Collagen is the scar that will become maximum on day 21 or week 3. Very good, means the same. Now the next surgery question, 2 years ago this was asked. Collagen that is formed in the beginning of the repair is going to be collagen type 3. Whereas towards the end of repair, it is going to convert into collagen type 1. So what did they ask you? Why does this 3 to 1 change in collagen happen? Because 1 is the strongest collagen. You want that your scar should be very, very strong. 3 to 1 ka change hota hai. Very good. This question I'm not asking you. When do you get 100% wound strength? Ma'am, we've been mugging it up since ever. That is going to be, the answer is never. Never does 100% wound strength happen. Okay, some of you had said that, ma'am, little slower. Does anyone else feel that? See, the purpose of me going faster is because, as I said, this is nothing new that I'm teaching you. I've taught you in main videos, then rapid revision, then LRR, and then on so many other YouTube sessions. So this is more of a asking you session. Like I said, the thumbnail is wrong. They shouldn't have put my photo. They should have, if they could, they should have put your pictures on it, because you are the ones conducting this session, right? Okay, and anyway, you guys listen to me on 2x. For the first time, I'm trying to be naturally on 1.5x, although I know I cannot. Okay, let's move forward. What are the questions that I expect from genetics? I expect questions on Prader-Willi and Angelman. Before I get into their imprinting story, we are going to be, Prader-Willi is always going to be chota mota bacha. Chota mota bacha means they will tell you that there is short stature, and there is going to be obesity. The reason for obesity is that these kids have a lot of appetite hormone. They feel very hungry. They keep eating all the time. That is, they have a lot of ghrelin. So short fat kid, that is going to be Prader-Willi. Whereas if they say something like happy puppets, the child is forever ever laughing without any reason. Without any reason he is laughing, happy, smiling, giggling. That is Angelman syndrome. So now they ask you what is imprinted in both and what is deleted. Most of you have told me in Prader-Willi there is paternal deletion and maternal imprinting, whereas in Angelman it is the opposite. And how did we learn this? Prader-Willi mein papa region is going to be deleted. So now you know what is deleted. Prader-Willi, papa region, PRDE, papa region deleted, paternal deletion, maternal imprinting. So papa deleted is Prader-Willi, and if mama is deleted, that is maternal deletion, that becomes Angelman syndrome. Okay, now we are done. Can I move forward to the next one? So either what they'll give you a clinical history of a short fat kid and they will ask you, okay, what is the defect in Prader-Willi, or they will give you a happy puppet and ask you what is the defect in Angelman syndrome. Perfect. Moving on to the next. This, you are sick of this question, but I have to make you answer it. Trinucleotide repeats. For Fragile X syndrome, what is the repeat? That is CGG repeats. You will tell me, especially FMG students, this mnemonic was made only for this day for your exam. How much should the CGG repeats be for Fragile X syndrome? Should it be less than 55? Should it be 55 to 200? Or should we go ab ki bar 200 par? So we always used to say ab ki bar 200 par. So if Fragile X syndrome has to have CGG repeats, it has to be more than 200. What about myotonic dystrophy? It is going to be CTG repeats. One more thing, CTG will remind you in ophthalmology what cataract is seen in these patients. So very perfect time as Christmas is coming up. So Christmas tree cataract is seen in myotonic dystrophy. What about Friedreich's ataxia? Friend Gana ga raha hai. So that is going to be GAA repeats. And what about Huntington disease? Hunting in a cage. So what are the repeats going to be? That is CAG repeats. Are they going to be in the intron or the exon? They are going to be in the exon. So this is the only disease which is in the exon. Means automatically all these other diseases are going to be in the introns. Done with this one very important. I don't expect one liner. I expect kuch match the following type will come. So I think you will be able to handle it. Pray for as many match the followings in the exam, because even if you know 2 answers, you can make a guesswork and get the other 2 right. So match the following is the best type of pattern to get in the paper. Perfect. Moving on to, you know, you're getting a question on karyotyping every time when you see these different chromosomes. In what phase do we do karyotyping? It is always done in the metaphase. Always best phase to do it is metaphase. For karyotyping, what is the fixative that is used? That is the Carnoy fixative. I hope you remember Carnoy. Carnoy fixative is what is going to be used. Okay, Mansi said coding, non-coding in the previous one. So Mansi, I also said the same, right? Because exon is extrovert, that is the coding part. Intron is introvert, that is the non-coding part. So I've used other names for it, but the meaning is the same. Coming back, phase is going to be metaphase. Fixative is Carnoy. Now I've seen one black and white kind of photo, one very nice fluorescent photo. So the most common banding or staining that is used is G banding. This is a question in previous year papers. What stain is used in G banding? It is Giemsa stain. The normal blackish whitish photo that you see is Giemsa stain banding. Whereas this fluorescent microscopy that you see, that is going to be Q banding. The full form is going to be quinacrine stain. We had always studied that for the queen you will need a fancy microscope. So for quinacrine stain you need fluorescent microscope, but otherwise for G banding you need a normal light microscope. Okay, perfect. Moving on to the next. You will again have to do fill in the blanks. I know you don't like that neoplasia chapter. So I have taken out the 3 most important mutations that you have to know for this exam. इससे कम नहीं कर सकते इसको. This much तो you will bare minimum have to study with me and go. So what is RET, KIT and BRAF mutation? Bare minimum you need to know for the exam. So RET, for RET ma'am we had one song, RET 10 med men. So that is how we used to study. RET is the name of the gene. It is present on chromosome number 10. The cancer that it causes is medullary carcinoma thyroid. And the syndrome in which it is seen in men 2A and men 2B, repeating, red gene 10 chromosome medullary carcinoma thyroid, men 2A, men 2B, red 10 med men. Before I move forward, tell me one pediatric disease that happens with red gene. If the red gene has a loss of function, red gene stops working, ma'am, then there is a disease you know in pediatrics, that is Hirschsprung's disease. I expect one question in Hirschsprung's disease in pediatrics, and that question will either be they will asking you something to do with red gene, so red gene is not working, that is why Hirschsprung's happen, or Hirschsprung's disease can also be associated with trisomy 21, means Down syndrome. So I'll write it small over here. It can also be associated with Down syndrome. So when red gene is not working, bachcha has Hirschsprung's disease. But when red gene is working a lot, there is a gain of function. That is when cancers happen, and that is medullary carcinoma thyroid. Who will tell me in surgery what is the tumor marker of medullary carcinoma thyroid? Quickly, chota questions otherwise. It is going to be calcitonin. That is the tumor marker of medullary carcinoma thyroid. Moving on to kit. Kit mein there are, we always remember that whenever you go to play games, you have to carry a kit. You don't remember all the tumors, chalega, but you can't forget c-kit. What CD marker is it? It is also known as CD117, and it is going to be increased or mutated in GIST. One question on gastrointestinal stromal tumor comes in surgery. Very, very important. Otherwise, it is also going to be mutated in AM for AML, ME for melanoma, and SE for seminoma. These others, if you remember, very good, but GIST and c-kit you have to know. Ab mujhe tell me GIST ka sir, I'm telling you about collateral question. That's why I said na 100 is just a number. I know we will touch 200 one-liners today, I can guarantee. So when I say GIST, what is the sensitive marker for GIST? It is the same as the mutation, ma'am, c-kit or CD117. But if I ask you the specific marker for GIST, it is going to be DOG1. Right? Okay, let's move forward to BRAF mutation. BRAF, first you have 4 things you have to tell me for BRAF. BRAF V600E is the name of the mutation. First you write HCL, that is hairy cell leukemia. Then you read it opposite, that is LCH, that is Langerhans cell histiocytosis. Then you have 2 P's. P in the thyroid, everyone knows papillary carcinoma thyroid. And P in the brain is going to be pilocytic astrocytoma. There are many more tumors. Like I said, this is bare minimum. मतलब पढ़े बिना नहीं जा सकते in the exam. This is that slide. So left to right, right to left. Hairy cell leukemia, Langerhans cell histiocytosis. Papillary carcinoma, pilocytic astrocytoma. They have given you this question so many times. Papillary carcinoma का orphan Annie appearance, and they will say with orphan Annie nucleus, which is the mutation seen? It is BRAF V600E mutation. Okay with everyone? Dr. Khushi, you are asking which thyroid tumor is common with P10 mutation? That is NEET PG के लिए important है. That is follicular carcinoma thyroid. Okay, moving on to the next one. You know one tumor marker has to come. I think 4 tumor markers will come because it will come most likely as a match the following. So number 1, most important, alpha fetoprotein. It obviously comes from yolk sac, so it's going to be in the yolk sac tumor. And it is going to be 2 liver tumors, that is hepatocellular carcinoma and hepatoblastoma. Yaad hai? 2 liver tumors and 1 yolk sac tumor. So what about CEA? C for C, colon cancer mein elevated hota hai. Then CA 125, even in your sleep someone asks you, I think you should be able to answer. Surface epithelial tumors of the ovary, perfect. CA 199 has been asked 1 million times in your paper. I can't count the number of times it has been asked. You flip the 9, you get a P. It is increased in pancreatic cancer. And CA 15-3, 3 mein se ma'am we used to make a B, so that is increased in breast cancer. The bare minimum tumor markers that you have to know, without which you can't go into the exam. I think this is settled. Okay, now I am going to show you a slide which all of you will hate me right now, but you will probably love me on the day of the exam, because you know one such question shall come. All the antibodies. Apparently this is one-liner from my end, but this will have 10 one-liners. So now you have all the antibodies for SLE, for Sjogren, for scleroderma. Matlab derma, path, micro, all antibodies in one place. Let's start with systemic lupus erythematosus, which is the most sensitive antibody, anti-nuclear antibody. Most specific is ASA, that is anti-Smith antibody. So sensitive is anti-nuclear, specific is anti-Smith, which is both sensitive and specific. That is double benefit. So double is anti double stranded, matlab dsDNA. So single pehle bata diya, then double benefit is anti dsDNA. Now neonatal lupus. If SLE occurs in a kid will always cry, ma'am, Rona, so anti-Ro antibody. And if SLE lands up with psychosis, so P for psychosis and ribosomal P antibody is going to be associated with psychosis. I think SLE antibodies are in one place. Now let's go to Sjogren syndrome. Before that, what is the simple word of Sjogren syndrome that you know? There are going to be dry eyes and dry mouth. So that means that a dry eyes, lacrimal gland ka problem. Dry mouth is salivary gland ka problem. Which antibody? Simple, Sjogren, S, 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 S. So the name of the antibody will be anti-SSA and SSB. The sensitive one is SSA, the specific one is SSB. They will not write it like that. SS for Sjogren syndrome. Itna easy hota, to why were we studying? SSA and SSB are known as Rho, La. So Rho is the sensitive and La is the specific. These are other names of these antibodies. Coming to scleroderma. Firstly, the question exam में तो ऐसा one liner नहीं आएगा ना. This is for revision. So how will a question of scleroderma come? They will say that there is sclerosis of the derma, means skin. Sclerosis क्या होता है? Sclerosis is becoming very stiff, very sucked, stiff, thick. The skin is becoming very thick. So imagine if someone's hands become the fingers become very thick, sclerodactyly hoga, that person will not be able to open his fingers. His fingers will become bent like this. So he will show you a claw hand. That is how they will write it. Or they will say a person's face is having scleroderma. Face has become very stiff, so he can't show you all those happy and smile, all those expressions that you are showing right now. He won't be able to show that. He will show you the kind of expressions you will show one day before the exam. जब बिल्कुल ऐसे numb हो जाओगे ना, stone faces, that ma'am we are not even happy or sad or angry, we are just numb in life. That is how this person will look. He will look blank. That is totally known as stone faces. Okay. Now, why does this happen? Limited scleroderma is because of anti-centromeric antibody, and diffuse scleroderma is because of anti-topoisomerase antibody. Okay. Done. So I think we are done with antibodies in one place. We are good to go. Ek last bata do, instead of SLE, if they would have in medicine asked me drug-induced lupus, I'm not revising those ship drugs because you know those ship drugs, but I'm still asking you what is the antibody for drug-induced lupus. It is known as anti-histone antibodies. Done. Perfect. Now moving on to thoda easy kar lete hain life mein. We have one person with this nodular swelling in the temporal region. Answer ban chuka hai ma'am. This is the temporal arteritis, which is also known as giant cell arteritis. Giant cell arteritis tends to occur in giants, means adults में होता है above 50 years of age. It is the most common arthritis in adults. अब इसके 4 questions are in front of you. जल्दी जल्दी खुद ही एक साथ लिख दो. In giant cell arteritis, which is the most common artery, obviously it is going to be the superficial temporal artery, and if the artery is involved, then the most common symptom is going to be what? The patient will have headache in that area. Artery भी यहाँ, headache भी यहाँ. But if they ask you what is the most specific symptom, it is going to be pain in the jaw, mandible. They will say mandibular pain, jaw claudication. But if they say the most dangerous symptom, that is vision loss, loss of vision. So that is why we always say for the treatment in medicine, you have to start steroids, but you have to start them stat. Don't wait for any report of any pathologist or any doctor. If you have a clinical suspicion, start steroids. You want to prevent this loss of vision basically. Okay, if they say what is the vasculitis with weak upper limb pulse, radial pulse nahi palpate ho raha, that is going to be what? Pulseless disease. So you will say that is going to be the Takayasu arteritis. In Takayasu arteritis, what is the vessel affected? Why is the upper limb radial pulse not being palpable? Because the subclavian artery is affected. Perfect. Someone said Takotsubo. Ab pata lag raha hai that you are studying too much. See, Takotsubo was a cardiomyopathy, that broken heart syndrome. This is Takayasu arteritis. I know you in your mind know that you have given the right answer, but while typing it, you are getting confused because jab zyada sab bahut kuch pad rahe hote ho na, multiple subjects, then you do these kind of errors. Okay, coming to the next one, which is the vasculitis in which the patient is hepatitis B surface antigen positive. So 30% cases, if they say patient is HBsAg positive, which vasculitis you will think of? Polyarteritis nodosa. Polyarteritis nodosa can involve all vessels, but P is not for P. It will not involve the pulmonary artery, will not be involved. Perfect. Which is the vasculitis with strawberry tongue? What ma'am, baby questions. Vasculitis with strawberry tongue is Kawasaki disease. I haven't written it, but I want you to revise the criteria for Kawasaki. Number 1, Kawasaki disease occurs in kids. So the child will be less than 5 years of age. I've done this in LRR also, but I still feel is pe kuch na kuch question aayega. Hence, I want to revise it again. So the criteria says patient should have fever plus patient should have any 4 out of the cream criteria. So I'm not writing. Jaldi se mujhe bata do what is C. C for conjunctivitis. The question that came in the recent NEET PG was, this conjunctivitis is purulent or non-purulent? तो ये तो blood vessel का problem है. This is not a bacterial infection. Bacteria होता तो pus आता. Over here there is no bacterial infection, so non-purulent, no pus, non-purulent conjunctivitis. Next is going to be rash. Perfect. Next is going to be edema. The child will have swelling, edema, adenopathy, lymphadenopathy. What is the question on lymphadenopathy? They say, where is the lymph node enlarged? So it is in the neck and one side of the neck. So it is unilateral and it is cervical. Next is going to be mucosal involvement, that is in front of you, that is strawberry tongue. So please remember, out of these 5, if any 4 are also present, chalega. Fever is mandatory, and after that cream mein se 4 out of 5 you are done. Okay, this is a question that came in last to last FMG exam. What is going to be the vasculitis in smokers? So we had studied B for BD and B for Berger's disease, but in FMG exam they asked you what is the other name of Berger's disease, and this is the answer that you had to give. That was thromboangiitis obliterans. Thrombo matlab blood clot, angiitis matlab itis, inflammation, and obliterans means blood vessel is obliterated. So again it is thromboangiitis obliterans. Perfect. Moving on to the next one. Can you guess this condition if I give you a clinical question also? One-liners mein, I don't know why I called this session a one-liner, but anyway, kuch title dena tha. So guess the condition. If I have these 4 things in front of you, that is purpuric rash, arthralgia, abdominal pain, and there is some renal involvement like hematuria. Ma'am, as soon as you are writing this, we are reading it in a Bengali accent and we are calling it purpura. Means this is a case of Henoch-Schonlein purpura. Yes, or Henoch-Schonlein purpura. And if I add one more A to it, this is caused because of an antibody, that is IgA levels being increased. Does it have any, is this purpura because of some platelet count going down? No, in this the platelet count is going to be normal. Sometimes it can be increased also, but decreased nahi hoga. This is not a dengue infection where platelet will fall and patient will have rash. No. Platelet is normal, still patient is having a rash, sorry, still patient is having a rash, and the reason for that rash is going to be IgA. It is an antibody mediated reason that comes up over here. Okay, coming on, perfect. I think I got all those answers. Next one, guess the cardiomyopathy quiz starts. So you have a cardiomyopathy where number 1 condition, you already have it written in front of you if your eyes are open. There is an alcoholic patient. As soon as alcoholic patient is there, ma'am, they always write alcohol ke saath, you always think of dilated cardiomyopathy. But tell me, if alcohol is in the options and they ask you what is the most common cause of dilated cardiomyopathy, and idiopathic is also in the option, please mark idiopathic. More than 50% cases of DCM, I don't know the reason. If idiopathic is not there in the options, then please mark alcoholic patient. I mean, just see where the question is standing. If genetic mutation is asked, you mark titin mutation. And what is the only, I mean, I never used to teach this for FMG students earlier, but now I feel they're asking you also a lot of I&I questions. So I want to tell you that what is the nuclear finding in dilated cardiomyopathy. Good news is inke paas iska ek hi photo hai, so they will have to give you this picture only. This is going to be the ninja star nucleus. Perfect. So we will write it as perfect, ninja star. Okay, done. DCM is done. Can you guess the next cardiomyopathy, which many of you were anyway saying you were confusing it with Takayasu earlier, but now I'm saying there is a severe emotional stress. They will say either there is a family dispute, the chacha mamas and tayas are fighting over some land or plot in the family, or there is someone who's lost her husband, or there's a death of a closed family member. Severe emotional stress means Charcot-Marie cardiomyopathy, which is also known as broken heart syndrome, which is the only ventricle enlarged. Left ventricle is what is enlarged. Other all atria chambers are going to be fine. Heartbreak syndrome. Perfect. This cardiomyopathy is like formality क्योंकि सब पढ़ रहे थे. As soon as you see a banana shaped heart, you know you are going to be dealing with hypertrophic cardiomyopathy. What is the mutation that you see in hypertrophic? आगे पीछे कर दो तो मैम, instead of hypertrophic cardiomyopathy it becomes beta myosin heavy chain. Myosin heavy chain, अगर MHC लिखा तो myosin heavy chain. Sometimes they write myosin heavy chain like this also. It means the same. Please don't feel that ma'am you taught us, हमने वो mnemonic या short form बनाया है, but instead of MHC they write myosin heavy chain as MYH. It is the same thing, guys. Please don't mark it wrong. And the main problem, it is a sudden collapse or death in a young, not necessarily athlete. Does not mean that if it's a non-athletic person who has just gone to play football for a leisure activity, he can also suddenly collapse and die, and that can also be hypertrophic. So he doesn't have to be a proven athlete for you to mark hypertrophic cardiomyopathy. Okay, perfect. Moving on to the next one. Although for FMG exam, cardiac tumors were never important, but this time you got questions in NEET also, in INI also, matlab pura 2024 you got questions. I feel they might just give it to you in January because they've given it in all exams. So there are only 2 cardiac tumors you have to know, and I always divide the heart into this window and I tell you to write Mr. because left atria में क्या होता है? Myxoma, and left ventricle में क्या होता है? Rhabdomyoma. Simple. So if they ask you left atria versus left ventricle, please write myxoma versus rhabdomyoma. You write a Mr. Next thing that you have is what cells are seen. So in a myxoma, what you see are going to be the lipidic cells, and in rhabdomyoma, what you see are spider cells. For the first time in pathology, what you read is genuinely what you see. वरना तो पढ़ते कुछ और हो, photo में कुछ और दिख रहा होता है. Here genuinely you've written spider cell, and genuinely what you see over here is spider web वाला cell. So you will not confuse this, and this could come in your exam. So myxoma, Mr. लिखो, myxoma, rhabdomyoma, left atria, left ventricle. This is going to show you lipidic cells, that will show you spider cells. Okay, tumor plop sound, Dr. Chaitanya said for myxoma. Yes, that is what you study in surgery and medicine. So myxoma occurs over here ना, that is in the left atria. तो left atria के पास कौन सा valve होगा? तो मैम मतलब when that tumor will, when the heart will contract, वो tumor ऐसे wall के साथ it will collide. With the valve it will collide, and we will get to hear a tumor plop sound. Okay, moving on to the next one. FMG exam specially, and for others also, every session 2 questions are coming from this slide. It will be a crime if I don't tell you in every session about this slide. Lung tumors, they will ask you the tumor markers. You know 3 lung tumors you have to deal with. Squamous cell carcinoma shows you of the lung. Only for the lung I'm asking you. The 2 markers are P40 and P63. The question that came in the FMG exam is which is the best one, and that is P40, that is the best one. Perfect. Next one, adenocarcinoma. Adeno had all the AA markers, that is napsin A, and A is the first alphabet, so TTF1 and MUC1, right? So napsin A, TTF1, MUC1, all AA11 for adenocarcinoma. Small cell, you know, chota packet, bada dhamaka. So firstly, bada dhamaka because it is going to be the most aggressive clinically, that's one thing. And the name of the markers are also all bada dhamaka types, tougher ones. So synaptophysin, chromogranin and NSC, these are the 3 main markers. Now what I believe कि ऐसा question हो सकता है, they are, you know, they've given you every question of this topic, every time they are increasing the difficulty level. तो एक बस 10 days के लिए, 10-15 days के लिए learn it for FMG exam. What if all the 3 options are given in the exam and they say which out of these do you think could be the best out of the best markers, and all 3 were there in the option? Then these days they are saying that for all of this, chromogranin is coming out to be the best. I mean, just one knowledge that you put in your brain. Please forget it on 12th of January, and for NEET PG students, 15th of, I don't know, whatever month. Right now they say 6 months from now, but I don't trust them. But whenever your exam happens. Okay, moving on to the next one. Identify the disease. One-liner mein clinical case. Identify the disease. There's a patient, he's having hemoptysis and hematuria. So bleeding in the sputum, bleeding in the urine. When these 2 are involved, there are other markers, of course. Dr. Prajapati, there are many, but right now we are narrowing it down as much as making it possible to make it concise for the FMG exam also, but you are totally right on the other markers. Okay, many of you are calling it Wegener's granulomatosis. Okay, that could be one option, and I am not denying it. Number 1, Wegener's granulomatosis, because that can show you involvement of the lung and the kidney, but that would have been associated with some antibody. Which antibody comes positive in Wegener's? Usually it is C ANCA more than P ANCA, but none of that information has been given to me. Now can you think of anything else with the probability that there is some collagen affected? Yes, with collagen it is going to be Goodpasture syndrome. So please note that what is given more. If they would have given me ANCA story, I would have gone for Wegener's. Now if they start giving me story of collagen, then I go for Goodpasture syndrome. You know Goodpasture is 1, 2, 3, 4. What is 1, 2, 3, 4? It belongs to RPGN1. It is which hypersensitivity? Hypersensitivity 2. There is involvement of alpha 3 chain of type 4 collagen. What is type 4 collagen? Basement membrane. So can I say this is anti-basement membrane antibody syndrome? Yes, Goodpasture syndrome. GPS pe question expected. RPGN1, hypersensitivity GPT2 alpha 3 chain of type 4 collagen. Let's move forward. Another expected question. You will get what kind of a history? Over here I was kind, I wrote the answer for you, but इसमें ये photo exam में आएगा, and let me tell you, exam में नहीं identify होगा. I shouldn't be saying that as a pathologist, but from a student's point of view, so look at this picture, I will not understand anything in this. It will look like a pink color gola, that's it. But in the exam, they will always give you the HbA1c level, and if that comes out to be markedly elevated, 8, 9, 10%, uncontrolled diabetes, you will know you're dealing with diabetic nephropathy, and the most characteristic lesion is Kimelstein-Wilson lesion. But they will not write Kimelstein-Wilson lesion, they will write the other name. It is known as NGS, that is nodular glomerulosclerosis. Nodular will tell me, okay, now whatever pink color I'm seeing nodules in it. If it has to be positive, it will be positive for pass. This is the most characteristic lesion. Don't worry, no one is going to give you this picture as a spotter. If you don't see this picture and you can't understand anything, read the history. They will say there is a diabetic, or they will not use the word diabetic, they will give you a hint of diabetes. Either they will say there is HbA1c which is 10%, 11%, pura uncontrolled, or they will say there is glucose coming in the urine. So you will get a hint of diabetes, and then of course this is something that you will mark. Okay, now coming to the next one is all the ulcers of the intestine, I feel would come in surgery for you guys, if not path, but that really doesn't matter. Somewhere an ulcer story will come of GI tract. So number one, coming back, Khushi is asking what is the nodular sclerosis part. So these are basically, Khushi, when you read the medicine, you read the pathophysiology of diabetes, there is glycosylated products that are formed in diabetes. So those glycosylated products are giving this pink color nodules, and that is the reason those glycosylated products are coming out to be pass positive. Yes, the session will be uploaded. Session भी upload होगा, यही रहेगा, कुछ delete नहीं हो रहा, PDF भी मिल जाएगा. Leave your miscellaneous worries, only focus on the session. Coming back to the ulcers, what is the infection which is going to have a longitudinal ulcer? जैसे tie पहनते हो, longitudinal, that is going to be typhoid. So if longitudinal is typhoid, then the transverse ulcer is going to be tuberculosis. Tie longitudinal, TB, transverse ulcer. Okay. Flask shaped ulcer, most घिसा-पिटा question. Amoebic ulcer means it is caused by Entamoeba histolytica. You don't get this right now, I would be very upset with you. So amoebic ulcer, flask shaped ulcer, you have to know. Moving on, these are the two where I feel students get a little lost. Where do you see serpiginous ulcers? Exactly how I've made, thoda snake like ulcers, those are seen in Crohn's disease. And where do you see superficial ulcers with pseudopolyps? Ma'am, as soon as you use the word pseudopolyp, we are talking about ulcerative colitis. So all the ulcers in one place. But I want to tell you that if ever a question comes that what is the single best way to differentiate between Crohn's and ulcerative, that one finding which is only and only seen in ulcerative colitis will be pseudopolyps. Pseudopolyps are never ever seen in Crohn's disease. Tell me their antibodies also, क्योंकि कुछ तो पैथो में भी पूछेंगे ना. Crohn's disease का antibody होता है ASCA antibody, whereas ulcerative colitis का antibody is going to be P-ANCA antibody. Why are you asking such a simple question, ma'am? Because there is an update. They will give, you must have seen this in QBank also, and many students have sent me a screenshot. For those who have not seen RR 6.0 and have only seen 5.0, this update you might have missed, तो अभी सुन लो. P-ANCA is positive in ulcerative colitis, Crohn's disease, or both. If ever that both wala story they get you stuck in na, then P-ANCA can be positive in both. But if you have to select the single best answer, then P-ANCA is positive in ulcerative colitis. That is an update. If you went, for those who not watched RR 6.0, never mind. This is not the time to switch. For FMG students, NEET PG students you can, but FMG students please don't switch. You just go through LRR instead, and usme updates I have included. So don't go through the entire video lectures again. Although this is not an image based session, but still these two images I feel would come. So these are, what are these needles that you use for bone marrow aspirate? They've been asked in every exam. We are sick of it. Ma'am, if the screw is on the side, that is known as the side screw wala Salah's needle. And if the screw is longitudinal like this, that is going to be the Klima needle. So side screw is Salah's needle and longitudinal screw is Klima needle. These are both for bone marrow aspirate. Perfect. Then next, if they say neurological symptoms are occurring with which deficiency? Nutritional deficiency. Neurological symptoms can happen with vitamin B12 deficiency. One more clinical manifestation, their favorite pigmentation wala photo, knuckle pigmentation is also seen with vitamin B12 deficiency, means megaloblastic anemia ke 2 questions, neurological symptoms and knuckle pigmentation is going to be their favorite. Okay, moving on to, and of course, I've not shown you images here, but LRR mein we have done all those Cabo ring, figure of 8, ya fir Howell Jolly bodies, all those for megaloblastic are very important. I'm making these small symbols because last day when you will be reading this PDF just on the go, probably in your travel time to the exam center, at least these small things on the side, they will give you some recollection. Next one. Talking about hereditary spherocytosis, when the RBCs are becoming very round and spherical, what is the most common mutation in hereditary spherocytosis? It is enchirin. Itna easy question nahi aayega, because when enchirin mutation occurs, the kind of hereditary spherocytosis is autosomal dominant. Aajkal they are asking you rare ones. What if it is autosomal recessive? Then the most common is going to be spectrin. So remember, what inheritance have they written? And ma'am, what if they don't write any inheritance? They just say, what is the most common mutation in HS? So assume the most common one to be enchirin. Okay, coming on to the next, what is the screening test for HS? I think everyone can answer. Osmotic fragility testing hota hai. No one does it nowadays. This is a question they will ask you. Osmotic fragility karte nahi hai. It's only a textbook thing now. Nowadays, what is the diagnostic test for hereditary spherocytosis? It is EMA test. You want to keep your life simple by learning EMA, do so. If you want to make your life tough, then the full form, it's the name of a stain called eosin 5 malamide stain. I've not written here, but ab treatment bhi bata do. For hereditary spherocytosis, the preferred treatment is going to be a splenectomy. And these days they are asking you these splenectomy questions in surgery, so I'm giving that to you. Moving on to the next one, the chapter that you hate but cannot escape, all the leukemia one-liners that I want you to know. Guess the leukemia. Firstly, whenever I say more than 20% blasts, what leukemia am I talking about? Ma'am, more than 20% blast is acute leukemia, less than 20% is chronic leukemia. So more than 20% blast, फिर child है, child में तो हम ALL बनाते हैं हमेशा, lymphoblastic leukemia. And lymphoblasts are always positive for, they are positive for PAS. So this is ALL. ALL, child, fit बैठ रहा है. Lymphoblasts are PAS positive and more than 20%, so acute leukemia. Then they say adult with or rods, that must be myeloblast, so that is going to be AML. Okay, if they say, now listen carefully, there is an adult with some bad looking cells showing crisscross or rods. What does that mean? Crisscross or rods will mean that now there is going to be formation of faggot cells or so many or rods are seen in AMLM3. Perfect. And only leukemia with DIC causing disseminated intravascular coagulation is also AMLM3. Tell me the treatment of AMLM3. It is going to be all trans retinoic acid plus arsenic trioxide. Atra plus arsenic trioxide, iska treatment पूछते हैं. Someone asked me in between, I couldn't read your name, but I saw the message that it said, can we do leukemia diagnosis on the basis of age? I mean, that is like, what can I say? If you, it's a cancer, you start diagnosing in life or in MCQ on the basis of age, everyone will come out with cancer then after that. This is not how you, this is a supportive finding. You always diagnose on the basis of the blast count. If more than 20% lymphoblast is there, ALL. More than 20% myeloblast is there, AML. Then you look at the age, that is my diagnosis fitting in. Age is just a supportive thing. Please don't give your diagnosis on the basis of the age ever in life or in the exam. Okay, which is the leukemia never associated with radiation? And your answer is going to be CLL, never associated with radiation. Okay, what is Evan syndrome? Ma'am, Evan is everyone. Everyone means RBC may be problem, WBC may be problem, and platelet may be problem. So WBC may, it is a case of CLL. Along with that, in RBC, patient is having autoimmune hemolytic anemia, and in platelet there is ITP. All these three things together, everyone getting affected, Evan syndrome. What is Richter syndrome? Rich hona. Small lymphoma changing into large lymphoma. Chota admi becoming bada admi. That is rich hona. So small is going to be small lymphocytic lymphoma becoming large DLBCL. Okay, now tell me the FMG ka favorite question. Where do you see convent schoolgirl appearance? Convent schoolgirl means everyone is wearing the same uniform. All the cells are looking the same. That is going to be CLL because I see lymphocyte. But college girl means everyone, no one wears uniforms in college. You are all dressed in pretty clothes. So college girl means all different cells are seen, and that is going to be CML. Convent school girl, same cell, same uniform, CLL. College girl, different clothes, different different pretty dresses. So different cells, that is going to be CML. I've not written the most घिसा-पिटा question that CML shows you translocation 922, which is Philadelphia chromosome. Treatment के लिए you give imatinib. इतना तो I am assuming that ये तो अब बिना रिवाइज करे भी सीधा एग्जाम में जाएंगे. Okay, moving on to the next question. Which we start off with, just taking a little bit time. Yeah, now we are here, so we have probably switched all of a sudden. I expect a question on Albert stain, and this is a picture. Firstly, what am I doing Albert stain for? There is a name of a granule known as volutin granule, and volutin granules are seen in a bacteria that is Corynebacterium diphtheria, right? Any doubts that I'm missing out in between, because it is very obvious that I must be missing out with so many comments falling in. Once this session is done, I'm not going to run away anywhere. Anyone who wants to stay back and ask doubts can, others can easily leave, okay? So coming back, volutin granules for Corynebacterium diphtheria, yeah, everyone has started shouting, ma'am, Tim, ye hame pata hai. So uska full form bhi bata do. T for what? You first add toluidine blue, next you add iodine, and third you add malachite green. So that is how you make it Tim. And just zoom into this picture so you can see the toluidine blue has given that color to the volutin granules, and the malachite green has basically made it green. The bacteria is green, Corynebacterium diphtheria. Done. Moving on to the next question that you have, I had to put it up. Condenser of a light microscope is where? Above the stage, below the stage, at the stage. Agar by chance bhul gaye ho, to have a look at this. Where is the condenser present? This is the condenser. Okay, so the condenser is present where? It is going to be present below the stage, exactly. And these days, actually they are giving you this question without the picture. Photo will not be there. They want you to see your visual memory, that have you ever actually seen a microscope? They know our reality, na, कि हम microscope देखते ही नहीं कभी in our MBBS days. We don't understand it. So condenser is present below the microscope. This answer I don't want from you. What is the maximum magnification? 1000x. You are sick of it. I am sick of it. So we all are. Moving on to the next question. Fluorescent microscope. It's exactly like a light microscope with two differences. Number one, it is going to have an ultraviolet light. Instead of a normal bulb, it will have an ultraviolet light. And then it will have a mirror inside it that is known as the dichroic mirror. So if they ever give you a photo, you say that, ma'am, dekhne mein to I thought it was a normal microscope, but along with that, they had mentioned that there was an ultraviolet light bulb, not a regular bulb, and along with that, they had put a dichroic mirror. Then I said it's not a normal microscope, it's a fluorescent microscope. So tell me the dyes for all. You are also sick of these questions, but last session of one-liners, I have to revise before your exam. So TB, for TB it is going to be auramine, rhodamine. I hope, while writing also I have become so habitual, this is how I write it. I hope none of you were writing it rhodanine, because rhodanine is a stain for copper, whereas for Mycobacterium TB it is auramine, rhodamine. For fungus it is flour, calco-flour white is the fluorescent stain, and for malaria it is going to be acridine orange. Everyone has given me right answers. Okay, so I don't know when will I get that one wrong. I'm behaving like the typical Viva examiner who wants that one wrong answer from all of you so that I can level it up further and get you in a trap. But a part of me is also very happy that I'm not getting wrong answers. What is the next microscope that we have? The microscope that looks like a spaceship, har jagah se enclosed. That is an electron microscope. The reason being that you have to keep it in vacuums. Electrons can't travel in light. Electrons have to be kept in vacuum. That is done. But they will ask you a question for fixative. Fixative for light microscope is 10% NBF, that is neutral buffered formalin, and fixative for electron microscope is going to be 2 to 2.5% glutaraldehyde. This question, along with that, now you will tell me what is the fixative that I taught you sometime back for karyotyping. Ma'am, for that you told us Carnoy fixative, and after some time when you go to gynae, they will ask you what is the fixative for a pap stain or a pap slide. Anyone? What is the fixative? It is going to be 95% alcohol or ethanol, whatever is written. All your fixatives in one slide. This is also very, very important in gynae. Now a controversial question. If they say for pap smear or pap stain, the fixative, option A, 95% ethanol. Option B, 95% ethanol plus ether. In many of the gynae books, this is said to be the right answer. But देखो fixative, pathology का strong topic है, gynae का नहीं है ना. तो pathology के textbook में जो लिखा है, please follow that. And for gynae topics, follow gynae books. So if you have options of only 95% ethanol, please mark that. Don't mark any other option. Okay, moving on to the next question. All controls you have to revise. One question in FMGE and NEET has to come. I've done it in LRR one last time, why not? So what is the control for hot air oven? All Bacillus species. So it is Bacillus subtilis, Bacillus atrophius, same bhai, atrophius, subtilis, cousin brothers, and Clostridium tetani. For autoclave and plasma sterilization, the control is the same. That is Bacillus stero-thermophilus. The only difference that I want you to know, autoclave का temperature is ma'am very high, 121 degree, and you remember 15, 15 minutes, 15 pressure and temperature, everything is very high. But plasma sterilization, they always ask me, it is done at a very low temperature. दोनों का control is the same, but temperatures are going to be very, very opposite. Okay, now coming to filtration. Filtration के लिए ma'am filter size normal average कितना होता है? Average filter size is 0.22 microns. This is an average they've taken of every filter on this planet. चाहे वो water filter हो या आजकल तो we need air purifiers, those filters. So every filter is going to have that. And please note, for filters you need a very small bacteria, that is B. diminuta, minute bacteria. Okay, for radiation I had told you pumilus radiation. So that is going to be Bacillus pumilus. Talking about gas sterilization, G for G, that is Bacillus globigi. In the last FMG exam, बच्चे बेचारे G ढूंढते रहे. That ma'am said for gas sterilization globigi दिया नहीं था because that examiner was an old examiner. Globigi is the new name. The old name of it was also belonging to the same family of this bhai, that is Subtilis atrophius. So my take home message is, if at any point of time you don't find your answer in the exam, the single next best answer that you can mark, that hoga to isi family member mein se. The next best answer is going to be Bacillus subtilis or atrophius. So now, on the basis of these options, can you tell me what is this machine? And in the exam, if you will be a little cautious to read, आपको कहीं ये छोटा छोटा sterad लिखा हुआ मिलेगा. You just have to keep your eyes open, because as soon as they say sterad, they are talking about plasma sterilization. Question number 1, plasma sterilization में plasma, this is not the blood plasma. They will ask you, where is plasma formed from? It is formed from hydrogen peroxide. Plasma is the fourth state of matter, yes. So they write the name of the machine, it is plasma sterilization. What do you keep inside this machine? What do you sterilize with this? So zoom nahi hota, pick, agreed. Then you just learn it as a white color ka dabba, and it will not come as a spotter. Once you will start reading options में होगा, is it an autoclave? Of course it doesn't look like a pressure cooker autoclave. You will read plasma sterilization, you will be like, हाँ, that white color dabba was. So now either the answer is staring at you or you work your way out. What do you put inside it? Ma'am, we put arthroscope and urethroscope. So the rule is that all the scopes like bronchoscope, endoscope, cystoscope, ABC scope, कोई भी scope हो, what do you clean it with? Ma'am, we clean it with glutaraldehyde, comes by the company name of Sidex. All the scopes go to Sidex, but arthroscope and urethroscope are better cleaned with plasma sterilization. Many of you are like, ma'am, wait, we have learned your lectures word by word. हम आपको बताते हैं अब आप अगला क्या पूछने वाले हो. That what about stethoscope? तो stethoscope patient में अंदर नहीं जा रहा. Like all these scopes, these are going inside the patient. Stethoscope is not. Stethoscope you put on the chest or you put on the skin. So that is cleaned with alcohol, isopropyl alcohol. Perfect. All of you have, एक होता है रटना और एक होता है बस पूरा का पूरा as it is verbatim that you mug it up. Moving on to the next one, these are a set of images, although this wasn't an image based session, but इसी से आपके सारे one-liners याद हो जाएंगे. So why is it that randomly I have picked up these images? Because everywhere I can see fermentation happening, and I see in microbiology किसी को fermentation याद ही नहीं हो रहा. Mannitol, sucrose, lactose, fermentation, sugars getting fermented. एक एक करके tell me the name of the organism and tell me what is the culture media that you will be using. Number 1, mannitol, I have made you learn as samosa. So samosa was, whenever we use something called mannitol salt agar, we are obviously checking for mannitol fermentation, and mannitol salt agar is used for what? Staphylococcus aureus. You can read it again. Staphylococcus aureus, mannitol salt agar, that is how you check. So this means Staph aureus will be mannitol fermenter on mannitol salt agar. Next, sucrose fermentation कौन करता है? Ma'am, sucrose fermentation is done by Vibrio cholera. Please remember one question of Vibrio cholera पक्का. Rice water stools question आएगा. Vibrio cholera is a sucrose fermenter. What is going to be the culture media you see it on? That is TCBS. TCBS is going to be S for sucrose fermentation. नाउ कमिंग टू लैक्टोज, लैक्टोज के अंदर तो हम नाम ही ऐसे याद करते हैं. व्हाट आर द लैक्टोज फर्मेंटर्स? मैम, ई कोलाई इज अ लैक्टोज फर्मेंटर, क्लेब्सिएला इज अ लैक्टोज फर्मेंटर. बोथ ऑफ दीज आर लैक्टोज फर्मेंटर्स एंड बोथ ऑफ दीज यू आर गोइंग टू चेक व्हाट आर द कल्चर मीडिया, क्लेड कल्चर मीडिया, मैकॉन्की कल्चर मीडिया. ये दोनों जो होते हैं दे आर फॉर लैक्टोज फर्मेंटेशन, विच इज बेटर. एक ऐसी थ्योरी एमसीक्यू बताओ. द क्लेड वन इज एक्चुअली सेड टू बी बेटर over मैकॉन्की. Now tell me all the colors before I show you the picture. जब mannitol fermentation होगा you will get a yellow color. When TCBS sucrose fermentation होगा you will get a yellow color. When CLED का lactose fermentation होगा you will get a yellow color. The only place where you will get a pink color on lactose fermentation is McConkey. If you don't, so now how I have learnt, ma'am, every fermentation on this planet will give a yellow color, but only McConkey agar gives a pink color. So let's see. They will write this as TCBS. कौन सा color मिला? Yellow. They will write this as CLED. कौन सा color मिला? Yellow. They will write it as mannitol salt agar. कौन सा color मिला? Yellow. But when they write McConkey agar, they will say the positive side is showing you what color? It is showing you a pink color. So all fermentations yellow, but McConkey shows you pink. That is how you learn. ये सारी fermentations में से any one I feel would come in the exam. If the gut feeling goes well, then something to do with Vibrio cholera has to come, rice water stool. So maybe they will put up. By the way, in the Jan last year also TCBS came in the very first paper 1 के first set का काफ़ी बच्चों का पहला या दूसरा question was this TCBS only. First set, first question. So students who had just seen all these YouTube sessions and gone, उनका वो first kick start हो चुका था, because as soon as they saw this, they said, oh, this is TCBS, this is Vibrio cholera. And once you get the kickstart thing na, in the exam, it goes well. Why I'm telling you this? Because for 50% students, the first question of the paper you will know, and after that 3 नहीं भी आते होंगे ना, you'll be like, चलो first तो आता था, the start is good. For the remaining 50%, the first question you will not know, and that should not make you ruin that entire set, because everyone is going to get a jumbled up mixed bag. So if you don't know a streak of questions, ऐसा एक time आता है exam में जब ना 10 questions back to back लगता है गए, एंड उसके बाद लगता है पूरा ही चलेगा. सो यू विल सी 1 आई डोंट नो, सेकंड आई डोंट नो, थर्ड तक यू विल स्टार्ट डाउटिंग वेदर यू एवर डिड MBBS डिग्री, फोर्थ तक यू विल फील यू एंटर इनटू अ रॉन्ग एग्जाम, कोई कैट के GMAT के एग्जाम में आके बैठ गए हो, समझ ही नहीं आ रहा है क्या चल रहा है. बट दैट इज अ स्ट्रीक ऑफ 10 क्वेश्चंस विच हैपेंस टू एवरी स्टूडेंट. You cross that 10 question ka streak, because 10, you know, those googly questions every examiner will put. You cross that streak of 10 questions, it is my guarantee the rest of the paper you will be able to follow it up. But जिसने वो 10 questions के incorrect streak में अपना morale down कर लिया, who's lost hope over there, is going to lose up on the end as well. So my only advice, whenever you feel everything has crashed, just remember these words of mine, that everyone will have those 10 minutes in the exam where you will feel it's gone. Just pass those 10 minutes. The other side is going to be fine. Okay, moving on to the next. Tell me all the diarrheas that E. coli causes. I think we'll be needing, for those who are clocking the time, we are 3 minutes away from 1, तो 1:10 तक session खत्म हो जाएगा, ठीक है? So my word on that. Talking about the next, enteropathogenic E. coli कौन सा डायरिया कराता है? P for pediatric, ये बच्चों में डायरिया कराता है मैम. Enterotoxigenic E. coli causes what? T for travelers diarrhea. Entero-invasive E. coli invade करेगा, bleeding होगा, so this will cause dysentery. Entero-hemorrhagic E. coli will cause some hemorrhage, that is hemolytic uremic syndrome, and it is going to be caused by a strain. This question has been asked so many times. Which strain causes hemolytic uremic syndrome? O157H7. Perfect guys. Next one, entero-aggregative. My gut feeling, if this table comes, तो ये आएगा. Entero-aggregative E. coli. All the E. coli have aggregated. कैसा दिखने लग गए? They are looking like stacked bricks. So they are looking as if they have aggregated one on top of the other, and they are going to cause persistent diarrhea. Aggregate होगा तो persist करेगा. How many days diarrhea? More than 14-day diarrhea is known as the entero-aggregative का persistent diarrhea. Okay, is that okay with everyone? So either जो gut feeling questions है, either aggregative का persistent diarrhea will come with stacked brick appearance. If entero-hemorrhagic आया, they will ask you the strain, that is O157H7, and if they decide कि इनको तो fail ही करना है in FMGE, and बहुत ही tough question though, so they will ask you which of these is diagnosed with a Serini test. Serini test is not a test done in us, it is a test done in guinea pigs and rabbits. Basically it's an animal test. तो एनिमल के अंदर इंजेक्शन बहुत इन्वेजिव टेस्ट होता है एनिमल के लिए. तो एंटेरो इन्वेजिव ई. कोलाई के अंदर ये इन्वेजिव वाला टेस्ट करते हैं. If the toughest most question has to come, हमने वो भी कर लिया. It's an animal test. अब animal की story नहीं पूछेंगे. Is that okay? Let's move forward. Once quickly you have to tell me this question which came in your FMG exam. They said that there is a medium called the Wilson and Blair medium, and this is used for differentiating which two bacteria. So we have studied that Salmonella and Shigella are always sisters because their culture media are all the same. If you ever have to differentiate them in a microbiology lab, you use the Wilson and Blair medium, and that is going to be positive only in Salmonella typhi and not in Shigella. So this black growth that you are seeing is going to be of Salmonella typhi. We had learned that Wilson is that bad boy who has created a fight between the two sisters. Till now Salmonella Shigella had same culture media. Wilson is that boy, he has won a trophy. He has finally won which sister? He has won and got into a relationship with typhi. He has won the trophy of typhi. So Salmonella typhi will grow and Shigella will, feeling bad for Shigella, but never mind, Shigella will not grow. Shigella left alone. Wilson, good boy. कहाँ का good boy? This is very bad. He's created a fight between her. He's good boy that at least he did not double date. But two time नहीं करा, that was good boy. If you want to see the positive in every bad thing, then okay, fine. Moving on to the next one. If you see something showing you these two, that is double kind of circles, fried egg के लिए होता है, right? So fried egg appearance is what? Fried egg appearance is mycoplasma. I mean, why are you even asking, ma'am? At this lunch time, we have better things to do. Mycoplasma shows you fried egg colonies. इतना stupid question नहीं आएगा. They will ask you on which agar does mycoplasma show you. So it is the PPLO agar, PPLO agar, which means telling you something important because this might be asked. PPLO means pleuropneumonia-like organism, okay, pleuropneumonia-like organism, which will tell me that, oh, this causes pneumonia. In fact, this is the most common cause of atypical pneumonia that they will ask you in the exam. Perfect. Next question, it lacks the cell wall. Yes, you are right. This mycoplasma, it's 2-3 things. Ek to it is the smallest bacteria. Second, it does not have a cell wall deficient. Okay, someone said इसमें Dr. Ritesh is saying, ma'am, इसमें cold agglutination test positive होता है. You're making me jump to 3-4 slides ahead, but yeah, it is, and I will come to that in a while. Coming on to the next 4-5 images I've got together. अगर ऐसा animal दिया तो bacteriology में only one bacteria where I want to see an animal, and that animal has these 9 bands. That is why he is known as the 9-banded armadillo, and that is going to be for Mycobacterium leprae. Perfect. Leprosy is grown inside this. India में इतना commonly नहीं मिलता. Therefore, instead of 9-banded armadillo, we are going to use mice. So footpad of mice is what we use. We inject them and then they grow. The animals will grow the bacteria, not culture media. Okay, coming to the next one, you will now tell me, this is something I expect in PSM actually, where they will ask you louse से क्या होता है, flea से क्या होता है, tick से क्या होता है. So I hope you, if you remember this mnemonic, this means you have had the patience to reach the last chapter of bacteriology, because last chapter में यहाँ पर आता है, right? Now we come to let fen tria PSM, which will tell me what from louse, what from flea, what from tick, and what from mite. ओके सो दिस इज कंफ्यूजिंग आई नो, बट एक तो ये निमोनिक का ही कोई मतलब नहीं बनता, पर और कोई निमोनिक नहीं. अनफॉर्चुनेटली यू विल हैव टू डू अ वेरी स्टूपिड निमोनिक कॉल्ड लेट फेन ट्रिया PSM. Let will tell you louse. Louse से क्या transmit होता है? It is going to be epidemic typhus. Next is going to be flea. Flea से क्या? Fen. N मतलब endemic typhus. N is going to be for endemic typhus. Repeating, louse से क्या होता है? Please finish it off here. If you don't study this with me, you are never studying it alone, I can guarantee. Louse के साथ क्या होता है? It is confusion हुआ मैम, epidemic typhus या endemic typhus. तो यहाँ पर epidemic रखना. Because with flea, it is going to be N. That is with flea, it is going to be endemic typhus. Okay, let fen हो गया, let हो गया, fen हो गया. Now coming to tria. Tria is tick. Tick is going to transmit Rocky Mountain spotted fever. Most important that you have to learn Rocky Mountain spotted fever. After that, every disease that has the word tick in it. Indian tick typhus, African tick typhus, or they write Australian tick typhus. I mean tick typhus, so you will know it is because of tick. What you have to know is going to be Rocky Mountain spotted fever. Coming to the next one, PSM, mite. With mite, there are two. One is going to be the rickettsial pox, and the next one is going to be scrub typhus. Last FMG exam, this is a question that you got. दो ही questions आते हैं scrub typhus पे. Number one, scrub typhus is because of the bite of which vector? It is because of the bite of mite. Okay, scrub typhus is because of mite. But कौन से bacteria से होता है? It's the most funny sounding one and hence students never forget it. It is going to be Orientia susugamushi. So always remember susugamushi, that is going to cause scrub typhus is because of the bite of what? It is because of mite, which everyone knows, and यही पूछा गया था last time. So scrub typhus is important. If you still feel it is very confusing, we can give it a minute. Let's quickly write let fen tria psm with you guys and spending half a minute more because why not? अगर question solve हो जाए तो it's worth it. Louse से क्या होता है? Louse से epidemic typhus. What is with flea? It is endemic typhus. What is with tick? Rocky Mountain spotted fever, Indian tick, African tick, Australian tick, दुनिया का कोई भी tick. Okay, and finally with mite, it is going to be rickettsial pox and scrub typhus. Okay with it? Coming to the next one that we have over here, another expected question, organism I have already written, Sporothrix schenki. You will tell me other way round. What is the history that they will always give you? It will always be a rose gardener. तो rose से उसे thorn prick हुआ. Thorn prick ma'am happened over here, but the lesions were forming everywhere. How is it spreading? It is going to spread via the lymphatic channels. Very important. Rose gardener में होता है. What sort of conidia do you see? It looks like a rose only, so you are going to see rosettes of conidia. What bodies do you see? In the center, when you see a round body, that is known as a cigar body, and around it you see a star, so that is known as asteroid body. Round wala is known as cigar body and surrounding wala is known as asteroid body. Perfect, done. They will always give you this question of Sporothrix schenki. Lymphatic spread होता है. ठीक है, मूविंग ऑन टू द नेक्स्ट क्वेश्चन. अब इतना बॉडीज याद करा मैम, फिर हमें वो कॉपर पेनी बॉडीज याद आना शुरू हो गया बिकॉज दे आर ऑल्सो वेरी इंपॉर्टेंट इन फंगस. वेयर डू यू सी कॉपर पेनी बॉडीज? दे आर सीन कॉपर कलर वाला, सो दे आर सीन इन क्रोमोब्लास्टोमाइकोसिस. हाउ कुड वी फॉरगेट? नो वन इज आस्किंग यू सच अ सिंपल क्वेश्चन. दे विल आस्क यू व्हाट आर द अदर नेम्स ऑफ दिस डिजीज. क्रोमोब्लास्टोमाइकोसिस, क्रोमो मीन्स कलर, दे विल रिमाइंड मी ऑफ दिस ब्राउन ब्राउन कलर, कॉपर पेनी. ओके, बट देयर अदर नेम्स आर MMS. everyone is writing, very good. Copper penny bodies are known as medullary bodies, muriform bodies and sclerotic bodies. Medullary, muriform and sclerotic bodies. Please don't mess up in these bodies. If they write cigar and star, cigar and star is seen in the rose gardener's disease, Sporothrix. If they write copper and MMS, that is medullary, muriform, sclerotic, that is going to be chromoblastomycosis. दोनों में ना gardener का history होगा. यहाँ पे they will say specially rose gardener has a thorn prick. Over here they will say some kind of a forest worker, not necessarily rose gardener but some forest worker who's walking barefoot, and you can see what has happened on his foot. He's got a cauliflower like lesion on the foot. तो please ध्यान से रहना between these two bodies in that excitement that मेरा question आ चुका है. Please don't mess it up in the paper. Now these two fungus, now you know which fungus is this. You can see these long hyphae. What branching are you seeing? I can see 45-degree acute angle branching and I can see lines inside it. I'm not zooming in because exam में zoom in का option होगा नहीं. So learn to look at these. Zoom in once and see and then zoom out and see. You can see lines. I can see septae. Yes. So when you are seeing acute angle branching है and septate है, so that is going to be Aspergillus. Very good. उल्टा अगर उन्होंने वो हमारा इंडियन मीडिया का फेवरेट ब्लैक फंगस जिसमें कुछ भी ब्लैक नहीं है वैसा बोला, सो दैट इज गोइंग टू बी म्यूकर माइकोसिस. हाउ डज म्यूकर लुक लाइक मैम? उल्टा, दिस इज गोइंग टू बी 90 डिग्री एंड एसेप्टेड. सो इफ आई नो एस्परजिलस का ASPE, acute angle and septate, mucor is going to be opposite. Which out of them is broader, Aspergillus or mucor? Ma'am, mucor is mota, so it is going to be the broad one. The broader out of those two is going to be this. So if someone says ma'am in the paper pictures are never clear, take it with a pinch of salt. If at all, chalo, let's solve this issue. If at all they give you an image which they don't want you to diagnose. See, if I give you this image, this means I want you to diagnose from this image. But if I give you a very zoomed out kind of a picture, I don't want you to diagnose the question with the image. I want you to read the history. So if I say there is a fungus which has gone and sat in the cavity of the lung. In the lung there is a cavity and inside that cavity this fungus has gone and sat. That is a classical feature of Aspergillus or Aspergilloma. On the other hand, if I say there is a blackish color lesion that is formed on the face following say steroid treatment or following COVID, जैसे COVID में black fungus बोला था. So if a blackish lesion is formed and the picture is seen, so then correlation will have to be done clinically if the photo doesn't help you. Many students feel, blame game हम exam में करते हैं कि फोटो ठीक नहीं था, hence I got it wrong. The point of an exam is just not testing your knowledge. The point of an exam is also how do you react in adverse situations when the image is blurred, when the image is not uploaded, half uploaded. NEET PG में तो half uploaded image भी आया हुआ है. Then also you work your way out. Don't give up is the main point, and especially Indian exams में तो do not give up सबसे ज़्यादा सिखाया जाता है. More than knowledge I will teach you, do not give up. क्वेश्चन पढ़ो, क्वेश्चन में हिंट नहीं मिला, ऑप्शन पढ़ो, ऑप्शन में हिंट नहीं मिला, इमेज देखो, कहीं कहीं से भी हिंट नहीं मिला, भगवान का नाम लो, बट गिव इट ऑल दैट यू हैव. डोंट गिव अप टिल द वेरी लास्ट मिनट. ओके, मूविंग ऑन टू द नेक्स्ट वन. अगेन समथिंग दैट आई एक्सपेक्ट. Most common cause of meningitis in an HIV positive patient, I think HIV positive CD4 count is low, that is going to be cryptococcus. तो cryptococcus की वजह से अगर meningitis हुआ मैम, two options. I will do lumbar puncture, I will take a CSF sample. CSF sample पे कौन सा stain लगाते हो? It is the negative stain, that is India ink or nigrosin. बट इफ आई टेक अ बायोप्सी ऑफ द ब्रेन, कोई करता नहीं है मेनिंजाइटिस में बायोप्सी, बट चलो मान लिया, इफ यू डू इट, देन व्हाट इज द स्टेन दैट यू पुट फॉर अ बायोप्सी सैंपल? दैट इज गोइंग टू बी म्यूसिकार्मिन. प्लीज रीड द क्वेश्चन केयरफुली. यू विल रीड क्रिप्टोकोकस एंड ऑलवेज मार्क नेगेटिव स्टेन. कहाँ पे कर रहे हो स्टेनिंग? इफ यू आर डूइंग इट ऑन अ CSF sample it is negative stain, but if you are doing it on a biopsy it is going to be म्यूसिकार्मिन. This is the question where I feel they will catch you. What is the diagnostic, gold standard diagnostic test for cryptococcus? क्या होता है? And all of you are going to say latex agglutination test, which is also the right answer. But in the exam, जेनेटिक्स से ऊपर कुछ नहीं होता ना. सी लैटिक्स एग्लूटिनेशन टेस्ट इज अ गुड टेस्ट, बट इफ एट एनी पॉइंट ऑफ टाइम दे हैव रिटन लैटरल फ्लो एसे, you will be like, hang on, lateral flow assay being genetically inclined as a test is better than latex agglutination test. Again RR 6.0 में ये अपडेट एडिड है, नहीं देखा तो प्लीज अभी सुन लो. lateral flow assay as a genetic test is better than latex agglutination test. जो भी होगा आंसर में, you mark that. Okay, I've not added the treatment because this came in the last to last FMGE exam, but पढ़ लिया होगा. What is the treatment of cryptococcal meningitis? It is liposomal amphotericin B plus flucytosine. Yes? Perfect, done. Moving on to the next one that you have, again expected one, aplastic crisis in hemolytic anemia. Some hemolytic anemia will be given like hereditary serocytosis, sickle cell anemia. तो मैम whatever hemolytic anemia is given, they will say bone marrow shutdown हो गया, aplastic crisis हो गया. Very good, that is going to be, take it all the way down to the next slide because I had written it. Parvovirus B19. So this is again, what are the questions on parvovirus? With parvovirus I have always shown you this Paro Aishwarya Rai, and I always told you that in the movie Devdas she was left alone because this is a DNA virus, and usually DNA viruses are double stranded, but our Paro is left alone. Paro is the only DNA virus who is left alone and single. She is the only single stranded one. ठीक है. Now coming to also one more reason why she is crying is because God made her the smallest virus. तो single भी रखा, smallest भी रखा. Parvovirus is going to be the smallest. Now tell me which is the largest DNA virus? It is going to be the pox virus. Pox की बाद में बात करेंगे. अभी parvovirus is small also, parvovirus is single also. Parvovirus bone marrow का shutdown भी कराता है. तो क्या क्या कराता है मैम parvovirus? It causes, you will always see a child with these red cheeks because it causes slapped cheek appearance, and slap will always be with hands, right? So this is going to be rashes on the hands also, rashes on the feet also. So number one, there is going to be slapped cheek appearance, rashes on hands and feet. They have called it gloves and socks syndrome. देन बोन मैरो में क्या कराएगा? बोन मैरो में फुल स्ट्राइक, कुछ भी काम नहीं करेगा. आरबीसी डब्ल्यूबीसी प्लेटलेट सब गए. दैट इज नोन एज एप्लास्टिक क्राइसिस. इफ ओनली आरबीसी गोज ऑन स्ट्राइक, मतलब डब्ल्यूबीसी ठीक काम कर रहा है, platelet is also working fine, only RBC decides I will not work, that is pure red cell aplasia. Tell me one thing, pure red cell aplasia is number one associated with parvovirus. Number two, any mediastinal chest tumor that can be associated with pure red cell aplasia, they will ask you, that is thymoma. मतलब हाँ, सर्जरी में क्वेश्चन आता है. वेरी गुड, परफेक्ट. मूविंग ऑन टू द नेक्स्ट. अगर प्रेगनेंसी में मदर को हो गया, मदर से बच्चे को पार्वोवायरस कैन गो, सो इट कैन कॉज हाइड्रोप्स फीटालिस ऑल्सो. Every word about parvo. Again, what is the DNA? It is single stranded DNA. What is the size? It is the smallest virus that we have. Everything about, and हाँ, some of you called it, अब slap cheek appearance को मैम fifth disease भी बोलते हैं. Yes, बोलते हैं. Anyway, we had learned के slap तो 5 उंगलियां छपना ना, all 5 finger slap, तो fifth disease उसके साथ जाता ही जाता है. ठीक है. Okay, can I move forward? Another expected virus that I have, which is the virus that I'm talking about. As soon as I see, ma'am, this ballerina skirt appearance that you see as downy cells, they are seen in Epstein-Barr virus. Number one, Epstein-Barr virus will enter which cells of my body? Not mine, not yours, but if it ever enters someone's body, so which cells? It will go into the B cells. So they will ask you which is the receptor via which it goes. It goes via CD21CR2. What is the name of the receptor? CD21CR2. कौन से cells दिखेंगे EBV के साथ? Downy cells. What are the tests? Expected question. There are two tests for Epstein-Barr virus. One is a Paul Bunner test and one is monospot test. आजकल का question will always be monospot because Paul Bunner test was an old test. आजकल का new test is the monospot test that we have. Perfect. Moving on to another question which is always asked. They write fever and 3C and what do you answer? मैम फीवर के साथ 3C, कफ, कोराइजा, कंजंक्टिवाइटिस. दे समटाइम्स डोंट, ऑल ऑफ यू समटाइम्स गो इन दैट बिल्कुल टनल विजन में जाते हो कि मैम ने कहा था 3C, हमने क्वेश्चन में ढूंढा कफ, कोराइजा, कंजंक्टिवाइटिस, मैम नहीं लिखा था. They won't write, they will write cough, they after that they might write the patient has red eyes, along with that patient has runny nose. तो इतना मीनिंग वाइज पढ़ के जाना. रनी नोज अलॉन्ग विद रेड आईज अलॉन्ग विद कफ. यू वोंट गेट कफ, कोराइजा, कंजंक्टिवाइटिस ऐसे लिखा लिखा सर्व्ड इन अ प्लेट टू यू. ओके, सो व्हेन दे सी दैट, यस यू आर टॉकिंग अबाउट मीजल्स. परफेक्ट. सो मीजल्स का इंक्यूबेशन पीरियड इज गोइंग टू बी 10 days एज पर पीडियाट्रिक्स. तो 10th day पे मुझे व्हेन द फीवर स्टार्ट्स, आई सी फीवर एंड 3Cs. After 2 more days, I start seeing Koplik spots. So means by the 12th day, I start seeing Koplik spots. And after 2 more days, I start seeing rashes. Where does the rash start? The rash starts here, ma'am, behind the ear, and after that the rash is going to go all the way down, right? That we all know. So pehle fever, then Koplik spots, and then the rash. So this is 10th day. Plus 2 करा तो मतलब 12th day पे Koplik spots, plus 2 करा तो 14th day पे rash होने वाला है. ठीक है? And you know incubation period I have taught you. Perfect. Moving on to the next one. One question on hepatitis has to come. Most likely marker of window period of hepatitis B always asked. Window period is that time जब कुछ भी blood में positive नहीं आ रहा. Window period is the time when hepatitis B surface antigen is also coming negative and anti-HBs antibody is also coming negative, but patient has hepatitis. Patient has hepatitis infection, but neither is antigen of the surface coming positive, neither is antibody coming positive. Then the only marker coming positive in that situation is IgM type of anti-HBC. The core antibody comes positive. That is the marker of the window period. ये तो सबको आता था. ये वाला बताओ if you can. Hepatitis virus which exhibits quasi-species. Maybe the FMG students have not focused too much on it. If you haven't, then please abhi kar lo, because hepatitis B to पूछ के थक चुके हैं. They might want to ask you something else. That is, hepatitis C virus exhibits quasi-species. What is quasi-species? इसका कोई definition नहीं है. Have you ever heard is there any vaccine for hepatitis C? No. Like hepatitis B का vaccine है, all of us have been vaccinated. Hepatitis C का, ma'am, we have never received a vaccine because the problem is that hepatitis C shows you quasi-species. Hepatitis C is that Telegram user ID, that scammer on Telegram. He sells you one course for 99 rupees and you feel, wow, I'm getting an app. He will take 99 rupees from you before you get the username and password. He will change his entire profile and block you. Then by the next time you tell me to block him, he will again change his username. So every time you go to block him, comes with a new username. That means that every time I try to make a vaccine, hepatitis C has undergone a mutation and has changed itself. Then I try making a new vaccine, it has undergone a change and changed itself. Mutation करता रहता है, change होता रहता है. So vaccine has never been successful. So that Telegram scammer who keeps changing usernames and keeps scamming people, that is hepatitis C. So next time, firstly, that is also, do not pay these people. If you do, and if you ever get stuck and he or she changes his username, he's undergone quasi-species. Okay, out of all the life cycles, I feel this could be one life cycle that could be asked. Anyone, what is the life cycle that I have over here? I have a machhar in the center and I have one bird on one side and one pig on another side, and they are saying dead end mein human kahin hai. This is the life cycle of Japanese encephalitis. Yes, and for Japanese encephalitis, that machhar that you're talking about is a Culex mosquito. Okay, so why did I tell you everything? Because when they ask you what is the reservoir is the bird. So the natural cycle is going to go on with the RD'd birds. RD'd birds are said to be reservoirs. But amplifiers kaun hote? Pig. When it starts going into the pig, the disease starts increasing. Okay, do we have a new vaccine? Don't tell me that SA 1414 वाला vaccine or the Nakayama Beijing, वो सब मत बताओ, कोई new वाला vaccine बता दो. That is known as Japanese encephalitis का Genvac vaccine. Yes, and उसके अंदर कौन सा strain use हो रहा है? That would be asked. I mean, it's very PSM, but why not? पूछा जाएगा. The Kolar strain is being used. Genvac vaccine. That is what is the latest update about it. Kolar strain, Genvac. Perfect. Moving on to the next question that we have. It's a pediatrics question. Rotavirus diarrhea कराता है, we know that. Rotavirus के लिए we give बच्चों को vaccine. We also know that. What is the complication of that vaccine? It is intiosusception. That is something they try to ask you in pediatrics. Rotavirus का complication नहीं है, rotavirus vaccine का complication है. This is also settled. Someone in the beginning was asking me about all these agglutination tests. So सारे agglutination tests in one place. This is also going to be the last slide, that second last slide that you have. There is cat sat on a mat. So agglutination test क्या होता है? Agglutination test is antigen antibody test. मतलब if you have a patient, you want to find out that has he ever been infected. Like if I wanted to find out all of us have been infected for COVID, I was trying to find antibodies in you and me. कि antibody मिला तो मतलब we are infected. Same way you want to find out has someone been infected with mycoplasma or brucella or leptospira. So you will say, अच्छा ma'am, let's find antibodies. So from the patient sample you are taking antibody and you are making it react with antigen. Reaction हो गया तो you will get agglutination. There is a cold agglutination, standard agglutination and microscopic agglutination. Cat sat on a mat, and cat is obviously in Hindi known as Billy, and that is how we learnt it. So cold agglutination test is for mycoplasma, standard agglutination test is going to be for brucella, and microscopic agglutination test is for leptospira. ऐसे one liner नहीं आएगा. Mycoplasma में what will be the clinical history? It is going to be most common cause of atypical pneumonia. Brucella is a zoonotic infection. They will always say कि कोई animal का milk है and after consuming that milk we have ended up getting the infection. So it's a zoonotic disease. It comes from animals to us. So there will be a history of milk consumption somewhere for brucella. For leptospira, I had always told you to write it as leptospira because who will tell me what is leptospira? The clinical history given, they will say that there is rat urine. Rat urine has gone and contaminated the rainy water. Okay, rat urine has gone into rainy water. Which are the farmers who need maximum rainy water for their harvest? They need farming के लिए rice fields में, ma'am. That will of course go to the rice field workers. Our rice field farmers will be affected the most. Exactly, that is what is leptospira. When rat urine goes into rainy water and goes then to the rice field workers, you will think of leptospira. That is, then they will ask you, acha, what is the agglutination test you will do? You will say, we will do microscopic agglutination test. Coming to the last slide for the day, you will get image based questions, but I want you to know that image ke bina, can you give me an answer? These are all malaria questions. When you see one trophozoite ring with one dot, what will you think of? One trophozoite, one dot, I will think of Plasmodium vivax. Okay, as soon as you said, when you see one ring and you see one dot inside it, one ring, one dot, vivax. When you see many rings and you see many dots, I think of Plasmodium falciparum. One more thing you see in Plasmodium falciparum is acoliforms. So when I look at this picture, ma'am, inside one RBC, you can see many rings and many dots. See, many 3 rings are there and multiple dots are there. And acoliform is this ring which has gone to the margin, गुस्सा होके जो side पे चला जाए, the one who got angry and said I'm going and sitting on the side. We always call acoliform as Fufaji, who gets angry in every family function. So acoliform said, oh, so many rings are over there, I am angry. So acoliform goes and sits on the side. So acoliform or the Fufaji is seen in falciparum only. Okay, where do you see band form? We used to learn it as mala band. So band form is seen in Plasmodium malariae. When it doesn't look like a ring, ma'am, instead of a ring it's looking like a band. So band form are seen in Plasmodium malariae. And finally, where do you see the Maltese cross appearance? Maltese cross is when you see 4 rings. 4 rings are making an X wala cross, and that is seen in Babesia. So that is the Maltese cross. I'm not zooming in. Try to look at pictures now without zooming in, so you'll get that cross appearance. Okay, so I know I've exceeded by 13 minutes from my time, but I think we've been good because this was not counted. When you later on see the PDF, you will realize that we have done many more than 100 one-liners, but that was the entire intent of this session, that to just tell you that 100 one-liners hai taki all of you come, but in that जर्नी मेक यू रिवाइज 200 वन लाइनर्स. ओके, हेडफोन वाला कौन सा था डॉक्टर तौसीफ? वही ये फैल्सीपेरम वाला. बेसिकली जब दो दो ऐसे डॉट्स दिखते हैं, व्हेन यू सी टू डॉट्स इट स्टार्ट्स लुकिंग लाइक अ हेडफोन. सम पीपल कॉल इट हेडफोन, सम पीपल से स्पेक्टिकल्स. अपना अपना इमेजिनेशन. दैट इज ऑल्सो प्लाज्मोडियम फैल्सीपेरम. Students who are studying and who want to leave, please do so. We are not going to discuss anything other than doubts here onwards, and for others who have doubts, please stay back. PDF you will get on Telegram. The session shall remain on YouTube. It is not going to be deleted. ऐसा हमें कुछ ऐसे छुपा के कुछ नहीं मिलेगा. Don't have these unnecessary tensions in your life. Focus on what is important. That is your studies. Okay. Now coming to previous one-liner कर लें. Path micro. I mean your wish. If you have already done that, go for it. Those also had a lot of INICT questions, so that might be slightly tougher. But if you can, why not? Okay. Confidence boost हो गया डॉक्टर अनुज. वही बस, एक्चुअली लाइक आई सेड, दिस वाज नॉट अ सेशन वेयर आई वाज टीचिंग समथिंग. इट वाज जस्ट टू गेट यू इनटू दैट मोड के करना चाहो तो पैथ माइक्रो का सुपर फास्ट अल्ट्रा इंपॉर्टेंट रिविजन 1 आवर में भी हो सकता है. ना करना चाहो तो 1 महीने में भी नहीं होगा. सो इट इज़ ऑल अबाउट योर माइंड सेट. That is exactly what this session was for. Trust me, I have not told you even one word new in this session. I have had zero contribution in your knowledge right now. Only just के when so many people will sit together तो जल्दी जल्दी रिवाइज हो जाएगा. That's it. Okay. पेपर 1 का स्कोर कैसे बूस्ट करो? देखो अब इस टाइम पे ना, वन थिंग आई वॉन्ट यू टू बी अवे फ्रॉम इज स्कोर कैसे बढ़ाएं. अब वो गया टाइम. नाउ यू आर इन द लास्ट very few days. I don't want to count to give you anxiety, but you are in the very last few days of your exam preparation. At this point of time, all that you have to think of is PYQs कर ले, volatile topics कर ले, and I revise all my LRR things. बस, this is your thing. Now don't think of what new topic I can read and what new main videos can I see to boost my, all that time is, you will waste time in fact by listening to all this. So right now focus on what can be done humanly in the last 15 days or so. जो हो सकता है बस उतना कर लो. एंड दैट इज एज अ ह्यूमन बीइंग व्हेन यू हैव 19 सब्जेक्ट्स एंड यू हैव 15 days, लेट्स से फॉर एग्जांपल. सो 19 सब्जेक्ट्स 15 days में क्या कर सकते हो? एक दिन भी नहीं मिल रहा पर सब्जेक्ट के लिए. सो ऑल दैट आई कैन डू इज PYQ, volatile and LRR again and again. And if you remember in my LRR series I told you December 25th के आसपास I will meet you again. Till then try to stretch your rapid revision as much as you can, because after December 25th I will not tell you to read again and again. I will say now is the time that please start switching over LRR, PYQ, images. बस अब वो सब देखो, because that is, yeah, exactly Dr. Shadab, LRR. but LRR only का ये मतलब नहीं होता कि वो 19 PDFs देखा, chill now, life is good, 2 घंटा पढ़ा. LRR of course is your mainstay now for the last 10-15 days, but साथ में you're doing PYQs, you're doing your volatile topics and you're revising images. That is when I say कि अच्छा LRR alone is good to go now. Okay. Different sorry, before that, CLED is preferred for Klebsiella. Yeah, CLED is, exactly, I've told you, over McConkey and CLED is better. What about pharma? I wish I could teach you, but as much as you hate it, I hate it. So not teaching you pharma. But what should you do for pharma? Let's take some subjects as के इसमें हमें ये नहीं आएगा, एंड तक ये याद नहीं होगा. से माइक्रोबायोलॉजी, बैक्टीरियोलॉजी एंड तक याद नहीं होगा. फार्माकोलॉजी, a little bit of biochemistry, a lot of PSM, till the end you will struggle. First, accept that. Second, you agree that पढ़ेंगे भूल जाएंगे, so don't judge yourself too much. Just every time you forget, you're like कोई बात नहीं, दोबारा पढ़ो. I will forget it after 2 days, कोई बात नहीं, दोबारा पढ़ लेंगे. That is what you have to take pharma also, with that pinch of salt that you will read and you will forget in 48 hours. सबका half life पढ़ोगे, your brain का half life will only get back to 1 hour or so. You will keep on forgetting things. Just take it like that. Every time you forget, read it again. That's it. Okay, from here onwards, you are going to go ahead with, as I've told you, here onwards का ही exact plan I had told you. These are the things you focus on. अगर like, just giving you as an example, today you want to do patho, assuming. So what you start now, you can't do full rapid revision also in 1 day ना, वो भी possible नहीं रहा. अब तो उतना time है. 1 day में ma'am, it's impossible to do 150 pages. So I will first pick up the 4-5 hours of LRR. Video अगर देखा हुआ है तो video भी मत देखो. Just pick up the PDF. I will first do the LRR, then I will go to my notes, I will revise all the images, then I will go and do all the PYTs. एक दिन में इतना भी कर लिया, मतलब you are studying 12 to 14 hours a day. That is when you will be able to fit in so much. Don't overburden yourself that in 10 hours I have to finish rapid revision. ऐसा हो पाता तो everyone would have been able to do it. That's not possible. ठीक है? Then confusion में option change हो जाता है. डॉक्टर शादाब वो अब होगा नहीं. बिकॉज यू हैव मल्टीपल सेट्स ना, तो मल्टीपल सेट्स में तो टाइम क्रंच और ज़्यादा रहता है. दिस यूज टू हैपन अ लॉट वेयर स्टूडेंट्स इन द एंड यूज टू चेंज 15 क्वेश्चन. एंड जस्ट अनदर टिप फ्रॉम माई साइड, योर गट फीलिंग वर्क्स इन द एग्जाम. जो पहला आंसर होता है वो ठीक आंसर होता है, अनलेस यू हैव डन लाइक अ कैलकुलेशन मिस्टेक इन PSM और यू नो सम काइंड ऑफ एरर अदरवाइज के गलत ही पढ़ लिया, टैकोट्स्यूबो को टाकायासु पढ़ लिया, दैट काइंड ऑफ सिली मिस्टेक यू चेंज योर आंसर. बट इफ यू आर ओवर थिंकिंग एंड मार्किंग समथिंग, वो कुछ गलत करने वाले हो, देन यू आर यूजिंग योर ब्रेन वेर इट इज नॉट रिक्वायर्ड. सो जो पहला आंसर है वो ठीक आंसर है, अनलेस इट इज ग्रॉसली इनकरेक्ट लाइक अ न्यूमेरिकल एरर और कैलकुलेशन एरर और पढ़ा ही गलत था मैंने, नॉट और एक्सेप्ट पढ़ा ही नहीं, तो चेंज करो. अदरवाइज प्लीज वहाँ पे अल्बर्ट आइंस्टाइन मत बनना. डोंट डायग्नोज न्यू थिंग्स, डोंट थिंक ऑफ रेयर डिजीजेज दैट आई हैव कम हियर टू बी अ साइंटिस्ट एंड अ very famous person. You have gone there as a common man, you have gone there as an average student. Think from a very common average person point of view. Okay, दो ऑप्शन में कंफ्यूज होना ही ये एग्जाम है ना डॉक्टर पवन. द purpose of any competitive exam, screening exam or MCQ based exam is to get to confuse you between two options, and you have to work your way out. And when you are confused in two options, don't say कि इन दोनों में से ठीक कौन सा है, मुझे ठीक वाला ढूंढना है. आपको एलिमिनेट करना है कि अच्छा इसमें ये क्लिनिकल फीचर दिया है तो दूसरी वाली डिजीज में तो ये दिखता ही नहीं है, तो वो तो नहीं हो सकता, इस वजह से ये वाला ठीक होगा. दिस इज द अप्रोच दैट यू शुड फॉलो, दैट रादर देन फाइंडिंग दैट वन बेस्ट आंसर, ट्राई कि वो क्यों नहीं हो सकता. ट्राई टू गो फॉर एलिमिनेशन अप्रोच. वेन एवर स्टक इन टू, एलिमिनेशन अप्रोच विल हेल्प. आज GT दे देते हैं मैम, बिल्कुल, द अर्लियर द बेटर. Also another advice, if your exam is on 12th of January, after my personal advice, after 4th or 3rd of Jan, please कोई GT और मत देना. अपना practice questions करो रोज के 200-250 जितना हो सकता है, but don't give a GT after 4th or 5th maximum, because last week you feel that whatever is your GT score is going to be the final score for a lifetime. If you give a GT also now, do it for time management. Don't do it whether you're crossing 150 or not. Do not do it for marks assessment, because you are giving yourself unnecessary anxiety which is not required. Okay. Maltese cross in cryptococcal meningitis, no, it is not seen. Maltese cross is seen in a lot of other things like Fabry's disease, nephrotic syndrome. For NEET PG INI it is important. Cryptococcus, rare cases yes, but I would not want you to learn it because that will be too advanced at your level. 20 questions. देखो अब डॉक्टर अद्वैत, इट डिपेंड्स. इफ़ यू आर डूइंग LRR यू हैव टू डू 200 क्वेश्चंस. फिर मुझे नहीं पता कैसे मैनेज करो, पर करना पड़ेगा. इफ़ यू आर सेइंग दैट आई एम डूइंग रैपिड रिविजन नोट्स एवरी डे, हाँ अलॉन्ग विद दैट मैम आई कांट डू 200 क्वेश्चंस, ठीक है, देन आई वुड सेटल बिटवीन अ 125 to 150 ऑल्सो फॉर यू. आई बी लाइक फाइन. बट अगर LRR कर रहे हो, वो 2 PDF कर रहे हो, उसके साथ तो 200 क्वेश्चंस निकालना है. एंड मोस्ट ऑफ यू आर नॉट डूइंग इट बिकॉज यू आर रीडिंग एक्सप्लेनेशंस एज इफ यू आर रीडिंग इट फॉर द फर्स्ट टाइम. जो ठीक हो गया वो तो ठीक हो गया ना. हैव दैट कॉन्फिडेंस इन योर सेल्फ कि मैंने ही ठीक करा है. इफ आई हैव मार्क्ड इट करेक्टली मीन्स आई हैव सम नॉलेज इन माई ब्रेन, दैट इज आई हैव डन इट करेक्ट. सो डोंट गो इन टू द डिटेल्स ऑफ दैट एक्सप्लेनेशन. द क्वेश्चन विच इज टोटली इनकरेक्ट, सुना नहीं था, पढ़ा नहीं था, सिली मिस्टेक हो गया, वट एवर रीजन, उनका एक्सप्लेनेशन पढ़ो. दैट वेज यू विल बी एबल टू सॉल्व 200 questions faster. Also don't go into question mode. Don't do question explanation, वो time गया. Give yourself a timer, 50 minutes 50 questions, or 45 minutes 50 questions. You take a timer, first finish all those 50 questions, then sit for half an hour and jaldi se read the explanation. Your speed will go up thereafter. Get into exam mode for solving Q bank now. Don't go question wise and explanation wise. Okay. Neurological symptoms, yes, Dr. Nizam, can be seen as well, definitely. How many GTs should be given? Dr. Saif, 2 at the max. अब you are 24th of December, 2 और दे सकते हो बस, उससे ज़्यादा तो 1 minimum, 2 maximum. बाकी but every day if you're doing 150 to 200 questions, GT हो गया एक तरफ से, मिनी GT, हाफ GT, वो इन अ वे वही चल रहा है. दैट इज व्हाई आई एम सेइंग योर डेली क्यू बैंक ऑल्सो यू स्टार्ट डूइंग इन द एग्जाम मोड. गिव योर सेल्फ अ टाइम ऑफ 45 minutes, कीप 50 questions ऑफ द क्यू बैंक एंड फिनिश इट. तो यू विल नॉट लेबल इट एज GT, तो वो GT वाला एंग्जाइटी भी नहीं होगा, बट यू आर एक्चुअली डूइंग द सेम थिंग ऑन अ डेली बेसिस. डॉक्टर दुर्गेश, बायोकेमिस्ट्री में येस, एज पर व्हाट आई हैव सीन इन द पास्ट, विटामिन से बहुत क्वेश्चंस आते हैं, सो दिस इज समथिंग यू विल हैव टू रिवाइज. No, window period and incubation period is not the same. Window period occurs after the infection has occurred already, but antigen is not visible, Dr. Khushi. But incubation period is ke abhi tak the symptoms have only not started showing. That is what is incubation period. Okay, what about doing past 5-year PYQs? Yes, that's 5-year PYQs to must hai. FMG ka 5-year karna hai, NEET PG ka even if you can accommodate 3 years right now, I think that is good enough. And INI CET you have to do what came this year, like 2024 ka May and November. And if you don't have papers, just go through those recall videos on YouTube. That's it. So FMG 5, NEET PG 3, INI just the 2 of this year, quick scanning through. That's about it. In Cryptococcus, no, Dr. Namrata, it should always be lateral flow assay as the answer. Dr. Sadiq, scoring low in micro. Anyone who's scoring low in micro has 2 options. You just need to select which one is a problem with you. Some people can't mug up because it's a very text heavy subject now, so you've got a lot to put into your brain. Are you having a problem with mugging up? That is one thing. Or are you having a problem that I've mugged up very well but I can't apply it to questions? So agar mugging up mein problem hai, I would suggest give one day and read all your notes of micro in one day, jaldi, but keep it very close to the exam so that even if you read it by 6th or 7th, you will remember it for 5-6 days at least. If you are having a problem in application of that knowledge, then give yourself small 20-20 question ka quiz every day. Make it a habit that every day at 9:30 p.m. for example, I will be solving 20 questions of microbiology, which will be a custom module mixed bag. And that way I will keep assessing my recall also and my application ability. Wherever you are having a problem, you just adjust as per that. Will I come live again? हाँ, I think I will because 12th of Jan बहुत दूर है. So I don't want to leave you guys hanging just on your own. So maybe we'll have something else. One-liner होगा, कुछ image based कर लेंगे. As I said, truly nothing new that I will teach you. But I will come again so that confidence booster के 1 hour में चलो 60-70 images देख ली, जल्दी देख लिया. We do it together, we do it faster. If you'll do it on your own, then you'll be sitting for one day with that entire image bank and wasting time. So that's it. I mean, something or the other we'll plan. We always do. An image session is like a feel-good factor and a good luck charm for all of us. We do it before every FMG exam. So we will do it. Don't worry. 115 champions exam, PrepLadder ka champions exam, I'm saying it on the prep platform only, is always tougher. It is always on the tougher side. It's deliberately made on the tougher side. It's not to give you any pseudo confidence case mein you are getting 200 because we gave you an easy paper. We want you to get the toughest of the toughest lot so that your final exam should look easier. So if you're crossing 150 in this means it's a very, very good thing that you have achieved. Even if you marginally crossed 150, I think that's very good. That's commendable because the actual exam I can guarantee will be easier than the champions exam that we give you here. Okay, in small cell lung cancer, nuclear marker was INSM. Yes, Dr. Prajapati, this I have told you in the LRR series also. This question came in the May INICT. INSM is a nuclear marker. It's actually to do with insulinoma, but Dr. Prajapati, that is not required. It's the pathogenesis of it is not required. It's to do with insulin production and insulinoma, but not at all needed. Question solve करें या custom module? Both. I've always told everyone कि एक तो जो subject जैसे आज पैथो कर रहे हो ना तो पैथो का क्यू बैंक करो साथ साथ the RR का क्यू बैंक or you do PYQ क्यू बैंक but do subject wise. End of the day, every day give yourself a 50 to 100 question का quiz or a custom module which is a mixed bag, or you can do small subject tests like you say today I will pick up paper 1 के subjects and I will give myself a 100 question का test in 2 hours I have to solve it, for example. That's how I want you to do. So most of your day you do a subject, end of the day you do 100 or 150 questions ka mixed bag. That will keep you in touch with both. Pathology, which topic? Dr. Durgesh, LRR ka jo first slide of every LRR, I have given you a list of to do topics. Path maybe, LRR part 1, part 2, micro maybe. Those are the most important topics that you have to do. Chromoblastomycosis, by looking at the basis of the foot, you will always get something adjoining because by looking at the foot, it can look at as chromo also, it can look like Madura foot, it can look like botryoomycosis. So kuch to hoga extra which will be written, like copper antibodies are written, so then you think of chromo. If they've written something to do with actinomyces or they've written something to do with eumycetoma, to wo Madura foot ki taraf jayega. So something extra they will have to give you. No one will tell you कि एक spotter एक photo है and अब diagnosis बनाओ. That doesn't happen. Yes, this video will be available on YouTube and PDF will be shared. लिबमैन सैक्स का वेजिटेशन, डॉक्टर विनय, बोथ साइड्स दिखता है. लिबमैन सैक इज द ओनली एंडोकार्डाइटिस where vegetation is seen on upper surface of valve and lower surface of valve, दोनों, but more commonly it is seen on the lower surface of the valve. Right. Vacutainous electrolyte, textbook में लिखा है electrolyte samples should be collected in the green vacutainer, which is heparin. Practically, green vacutainers, practically telling you what I do in my lab, green vacutainers we don't get in manufacturing, so we do it either in red or yellow. But MCQ question आएगा, ideally electrolytes should be done in green vacutainer. Unless green is not there, then you mark red or yellow, whatever is there in the options. Most common mechanism of gene transfer नहीं होगा डॉक्टर प्रवीण. The question must be what is the most common mechanism of gene transfer for antibiotic resistance. For antibiotic resistance it is conjugation, but for Staphylococcus aureus the transfer of antibiotic resistance is more commonly with transduction. That is the question I think that you must have got. Okay, Dr. Ardhendu, second year students, so I would be meeting you again at 5 in the Prof Edge live classes that are going on. So today only the classes at 5 o'clock. Much needed career guidance post FMG. हाँ तो post FMG अभी नहीं, this is not the right time. अभी many students are going into FMG exam. They are very anxious about it. We will have a separate session for that. 135 the better score. See, right now of course 150 you should be crossing, but all that I'm saying is even if you're not crossing, your entire preparation still remains the same. You have those 19 subjects, you have 15-20 days in hand, you have to go for the same series of things that I have told you to. So please stop being very number oriented, stop being marks oriented. That is why I'm saying rather than giving 1 GT every alternate day, which many people are giving right now, I would suggest start making custom modules of 150 questions and giving them every day in the morning or the evening, whatever time suits you. So you're not labeling it as a GT, but you're doing it in the same time constrained manner that you should be doing it in, and you're not calculating your score. You're just doing it for time management, for practice, for looking at questions, for solving clinical questions. That should be the mindset right now. Please don't ask me मैम 140 है तो उस दिन क्या होगा. उस दिन तो कुछ भी नहीं पता. I wish I would have known उस दिन क्या होगा. I would have given you the entire paper only कि please इसे रट के चले जाओ. We wouldn't have worked so hard all our life. So the reason is that now no one can tell you उस दिन क्या होगा. On the basis of you give me that I'm right now I'm getting 142, what will I get on that day? I wish I could tell you to that extent. I would have. Long back I would have told you. So right now don't think of what if. अभी बस अपना जो काम चल रहा है ना, 20 दिन 19 सब्जेक्ट बचे हैं, करना है, यही प्रोसेस करना है बार बार बिना सोचे. डोंट बी गोल ओरिएंटेड, रिजल्ट ओरिएंटेड, नेक्स्ट डे ओरिएंटेड भी नहीं सोचना. बस आज क्या करना है उतना खत्म हो जाए, ठीक है, सो जाएंगे, कल सुबह उठेंगे फिर सोचेंगे क्या करना है. दैट्स इट. ओके. Dr. Bhagwati, in case you want to increase, like if you're not touching till now 150, this means कहीं ना कहीं दो सिंपल होता है. देखो हमने YouTube पे बहुत सारी वीडियोस देख देख के ना इसे अननेसेसरीली कॉम्प्लिकेट कर लिया है कि ये टेक्निक फॉलो करो, वो टेक्निक फॉलो करो. दो टेक्निक्स हैं यार, या तो नोट्स याद नहीं हो रहे या क्वेश्चन सॉल्व नहीं हो रहे. नोट्स नहीं अच्छे से याद है means you are having recall issues. You are going to revise your notes more in the last days. If you know your notes that ma'am, yeah, I know all these like one-liners you were telling me, I was very good at it, but now when a question will come in front of me, I will mess up. This means your application is missing. Then you divide your day, half day notes revise karo, half day 200 question karo. That is how you settle. There are only two ways of solving this exam. Read your notes and solve the questions. कोई इसमें third ऐसा extraordinary out of the box strategy है ही नहीं. You make silly mistakes. Where are you going wrong? Dr. Supriya, what sort of silly mistakes? एक होता है कि हम पढ़ते पढ़ते ना we see that oh there's a question on chromoblastomycosis, ये तो मुझे आता है. That overconfidence kicks in and then you don't read कि अच्छा they had asked instead of copper penny bodies they had asked the other name या except पूछा था. In that overconfidence quickly I skipped it. This means you need to start giving time and reading. ऐसा जैसे childhood में line ऐसे finger के साथ line लगा लगा के पढ़ते थे ना कि एक एक word अच्छे से पढ़ के attempt करो. Second is that you are making silly mistakes like you are not being able to recollect properly. That means you require more practice of MCQs, be it your Q bank or your PYQ bank. But उसमें ये है कि आपको जितने ज़्यादा MCQs करोगे you will catch where you go wrong. You will be able to gather what is the mistake that you are doing. So to increase your score at this, silly mistakes if you want to avoid, practice is the only solution. And the at least, I mean, by now I had told everyone to cross 200, but अगर ये बहुत overwhelming लग रहा है तो 150 per day तो cross करना ही करना है. Questions I'm saying, 150 questions से ज़्यादा you have to be doing. PYQ के परसेंटेज को काउंट करके कुछ भी नहीं होने वाला. PYQ रिपीट होते ही नहीं है. एक वो आउल आई अपीयरेंस और एक वो क्रम्पल टिश्यू पेपर अपीयरेंस के अलावा कोई PYQ रिपीट नहीं होगा. PYQ इज नॉट व्हाट इज PYQ. आई मीन दिस इज ऑब्वियस, वी आर टॉकिंग अबाउट PYTs. PYQ में 50% क्रॉस हो रहा है, एंड दैट इफ यू आर थिंकिंग दैट ओ आई एम इन अ वेरी गुड स्टेट ऑफ place over here, it's wrong. You have to assess your score on new questions. वो तो रट लिया अभी तक, तो you guys will also tell me उसका आंसर A था, उसका C था, इस ऐप में A दिया है, उस ऐप में C दिया है. This also you will tell me because you guys mug up PYQ to that extent, but giving you the ground reality as it is, copy paste आएगा ही नहीं, उसमें कुछ ना कुछ change होगा. So previous year topic is what you focus on. Scared of giving GTs because it will demotivate you. Dr. Akshata, you are not the only one. This is everyone's problem. मुझे भी आज बोलोगे ना शाम को एग्जाम है, I will also have palpitations, I will also feel scared. चाहे वो एग्जाम मुझे अपने घर पे आराम से बैठ के देना हो, चाहे that does not decide my future. Still, I will say the thought of giving an exam in any format, in any environment, always scares every human being. So you are not different. What is scaring you is not giving an exam. Sitting for 3 hours, 4 hours, 6 hours is not scaring you. उसके बाद वो जो रिजल्ट 150 से नीचे आ जाएगा, what if that is scaring you? तो रिजल्ट मत कैलकुलेट करो please don't calculate your marks. Right now you get 180 or you get 140, God forbid. It is the same because there is no change in your strategy. आधा दिन नोट्स पढ़ने हैं, आधे दिन 150-200 क्वेश्चन करने हैं, इसके अलावा कुछ करना ही नहीं, चाहे कुछ भी आ रहा हो आपके रिजल्ट में. So when that result is not going to add anything to your bag, why are you making it the sole motivation for giving an exam? Your motivation is, can I complete my questions in a time frame? Can I finish that set 5 minutes earlier? Can I not do silly mistakes? Can I give my exam at 9 in the morning because usually I've been sleeping till 12 in the afternoon. I was a night owl. But now I have to give an exam in the morning at 9. Can I be alert at 9? These are the things you should be worrying about. All of you are worrying about that 150 pass हुआ या नहीं हुआ, बस उस पर आगे कुछ देखते ही नहीं हो, and that is the mistake that you're doing. Score is not going to be copy pasted in the exam. ऐसा कुछ नहीं है जिसके I've seen people getting 180 in GTs and not clearing the exam. I've seen people getting 140 in GTs and clearing the exams with 180, 190 score. I have seen every end of the spectrum. Your GTs for your practice, GTs for your time management, for assessing your weaker areas and working on them. That 150 is useless. Stop focusing on it. Okay. डॉक्टर प्रवीण, नोड्यूलर ग्लोमेरुलोस्क्लेरोसिस सबसे कैरेक्टरिस्टिक लीजन है, बट सबसे कॉमन लीजन डिफ्यूज ग्लोमेरुलोस्क्लेरोसिस है. तो मेडिसिन में जो डिफ्यूज लिखा होगा ना, उसके आगे यू मस्ट हैव रिटन मोस्ट कॉमन, बट मोस्ट कैरेक्टरिस्टिक इज नोड्यूलर ग्लोमेरुलोस्क्लेरोसिस. ओके, सो आई थिंक वी आर सेटल्ड, एंड ऑफ कोर्स लाइक आई ऑलवेज से दैट कोई भी अगर सेशन होता है देन दैट रिमेन्स ऑन यूट्यूब, बट आई कीप फॉलोइंग दैट लिंक फॉर 4-5 days so that whatever queries I have missed out in the session, I always request students कि उसी के comments में please write it down so that I can always get back to you once. I keep following that link again and again, at least till your exam 12th of Jan. I will be following it. So anytime till 12th of Jan you want to ask something, academic, strategy, doubt, कुछ भी हो, and you don't know from where to reach me because there are so many platforms like Insta and Telegram जिसमें time लगता है. So this is one link I will be viewing every day. Any doubt you have and any help you need till Jan 12th or till our next YouTube session and you want to reach out to me, ask me anything, just put it in the comments, and I'll try my best that within 24 hours or even earlier, I'll be able to help you out. So at least you will know this is that one link where you have to reach out to me for any concern. Okay, perfect. So, right, and yeah, and I didn't read through some doubts because I kept noting it down that you guys want bodies को एक जगह integrate कर दो, images को कर दो. So all that I'm keeping mentally as a feedback in my mind because I will come with another session and that session will have all the things that you've told me. So that I've noted down and I'll make sure that I include it in the next session. Right? So thank you so much, guys. All the best. Study well. I know with winters and with festivity of course around, you don't feel like studying. It's very sad that you have to be studying this new year, but just hope that the next new year is, if you study this new year, I can't say next you will be celebrating, because the next you will be on some night shift as an intern or as a resident, but at least you won't be studying. So that's the positive side of it. But yeah, at least this should be your last new year that you're spending with your textbooks and Q banks and YouTube videos, academic ones. Life on the other side will have work, will have night duties, and will also make you miss a lot of festivals, but at least you won't have textbooks. You won't be studying Serratia and Pseudomonas and Leptospira, rat urine. Itna bura nahi hoga life mein, isse better hi hoga, right? So just give it that, not 100, that 200% that you have right now, and give it all. Just don't think of what will happen on the day of the exam. Bas wo thought dur rakho. Someone talks to you also about 12th Jan morning na, just don't engage in that conversation. Only focus on mera aaj ka to do list khatam karke hi sona hai. That is my only small little agenda in life, and the story ends there. Thereafter I will take my 6 to 8 hours of beauty sleep, which I will try. You will have insomnia, 6 hours manage kar lena, else you will go blank. Change your sleep cycle, make yourself an early bird, start waking up, start solving MCQs by 9 a.m. because that is exactly what will happen in the exam. And that's it. Utna 24 hours ka survival karo, so jao, agle din ka agle din socho. That's it. Okay? Okay. So I'll meet you soon. Now, of course, I'll meet you live in the new year, but we'll have another session which will be most likely image based, but I'll think of something good and we'll meet in the first week, right? Thank you so much.